We are now here to start our session. May we please have it after the session, the dialogue. All my friends are requested to kindly settle down. Thank you so much. And once again, a very good morning to all of you. I am Shilpa Bhavna, and I extend my heartiest welcome to you on this third day of World Toilet Summit 2025. And it is the final day as well. So I would like to tell you that all these 3 days have been really wonderful, where we could see that how the ideas are turned into actions and how the commitment is turned into change. So we expect that change to take the place of transformation in the coming years with your initiatives, with your efforts, and all of our collective support. So my dear friends, now we are starting with this Day 3 proceedings. So firstly, I would like to tell you that we have got a video for all of you. On behalf of the Special Envoy Ambassador, Retno Marsudi, I would like to convey that the video message of the UNSG Special Envoy in delivering keynote remark for the World Toilet Summit 2025 has been received. So we would like to showcase you that video. So may we please have the video on screen and have a round of applause for this wonderful morning today.
Excellencies, colleagues, ladies and gentlemen, I thank the co-organizers of this event for inviting me to this summit. This summit is timely as we commemorate the World Toilet Day this year. I'm sure this summit will contribute in advocating for the message that we spread with this year's World Toilet Day theme. That is, sanitation in a changing world will always need the toilet. Distinguished participants, colleagues, ladies and gentlemen, it is not an overstatement. From the moment we're born, sanitation has become a basic and fundamental need for every human. It safeguards our health, it sustains our well-being, and preserves our livelihood. Therefore, focus and attention to sanitation and toilet in this meeting must never be discounted. To ignore toilet is to ignore humans' dignity. Unfortunately, today, billions of people still lack access to safely managed sanitation. The causes of this great challenge come from various circumstances. In some communities, it is shaped by inadequate understanding on the urgent need for toilet. In some others, it is caused by lack of infrastructure or financing capacities. However, despite the multiple reasons behind it, one thing is clear: this has to be addressed. Sanitation must be available for all. Colleagues, distinguished participants, we have enough evidence how lack of safe sanitation in one community can lead to water contamination, spreading diseases and epidemic to multiple communities. Therefore, addressing challenges at global, national, and local level is a collective work. WHO reports indicated a good progress in global rate of access to safely managed sanitation, from 53% in 2018 estimated to achieve 80% by 2025. This show of progress must encourage us further that sanitation for everyone is possible, and we should not stop until that happens. Through this summit, I believe all of us will discuss and share each other's best practices in making sanitation for all a reality. I hope the result of discussion in this summit could further inspire more innovation and action globally. I hope you all a fruitful summit and happy World Toilet Day 2025. And I thank you very much.
Hello. Such a wonderful message from ma'am. And now, friends, we are here for this session 4 on this day 3 of World Toilet Summit 2025. And this session 4 speaks about health, water, and sanitation, breaking the chain of infections. Because whatever we are doing in our lives, it's very much important to be away from those kind of infections, either the work or the health, everywhere. This is the thing about which we have to be very much vigilant. So in this session, we are going to highlight the direct and critical link between sanitation, public health, and global health security. Let me tell you that unsafe water and poor sanitation drive 1.4 million preventable deaths annually from infectious disease like cholera and diarrhea. The discussion focuses on top wash-related pathogens spreading through contaminated water, food, or hands, demonstrating that how robust sanitation serves as the first line of defense against infections and antimicrobial resistance and building public health resilience. So this all session is going to be on defensive mode, I feel. So let me please join over here on the dais the eminent panelists who are going to do that defense against the infection. So please put your hands together for Professor Dr. Indra Chakravarti. I invite you, ma'am, on the dais. Professor Dr. Indra Chakravarti is a renowned public health specialist, specially acclaimed for her work on WASH, food safety, nutrition, and environment. A Padma Shri recipient, ma'am has also received many international awards, like the Edward Somyo Award for the FAO of United Nations, President Global Leadership Award on Public Health from USF, USA, and other several awards. She had helped various portfolios under All India Institute of Hygiene, Chitra Ranjan National Cancer Institute, both under the Government of India, WHO and CRO. She was also the Chief Advisor to the Public Health Engineering Department of Government of West Bengal. She has worked as consultant to WHO, FAO, UNICEF, UNDP, World Bank, and much more in more than 25 countries. So let's have a round of applause for Professor Dr. Indra Chakravarti. And now I would like to invite our next panelist over here on the dais. Please join me in welcoming on the stage Mr. Chaplop Paso. Please put your hands together for his welcome. I invite you on the dais. He's the founder of the Bhutan Toilet Association and a leading voice in transforming Bhutan's toilet culture. Honored with the title Chaplop, that means the toilet teacher, by His Majesty the King, he has pioneered initiatives like the Jinpa toilet movement to promote clean, accessible, and community-driven sanitation across Bhutan. So welcome, Mr. Paso. Let's have a round of applause for him. Now I would like to invite Mr. Juan Carlos Acosta on the stage with your round of applause. So he's a business development manager at Thermoform SAS, specializing in portable sanitation and wastewater solutions. With over 5 years of experience in international sales and product development, he drives innovations in portable sanitation to improve hygiene and sustainability worldwide. Please put your hands together for Mr. Juan. Now, please join me in welcoming on the dais Mr. Birger Lundgren on the stage. Please put your hands together for him. He is the CEO and founder of Sanitation Ambassadors, a South Africa-based non-profit delivering scalable, hygienic, next-generation sanitation system. His work focuses on school and community sanitation, gender equity, job creation, and advancing circular economy solutions for dignified and sustainable sanitation. We welcome you, Mr. Birger, on the dais. And now let's welcome on the dais Professor Jan Felix Buescher. Please put your hands together for his welcome. He's the associate professor at the Saw Wee Hawk School of Public Health in US, and he's a specialist in microbial ecology and evolution. His research examines the molecular evolution, transmission, and emergence of endemic pathogens, offering key insights into infectious disease and public health. Please put your hands together for him. Now I would like to invite on the dais Dr. Sunur Verma. Please put your hands together. I invite Sir. He is the Director of Partnerships and Advocacy at WISH, Qatar Foundation, with 25 years in global health policy and development. A former cardiothoracic surgeon turned policy strategist, he has advised WHO, UNICEF, UNDP, and top universities, and founded major global health initiatives, including the Geneva Health Forum. So please put your hands together for Dr. Sunur Verma. And now I would like to invite our last but not the least, the panelist, Mr. Ganesh Pangare. Please welcome him with your round of claps. So he's a global leader in water resources, climate resilience, and sustainable development with over 3 decades of experience across Asia Pacific, Africa, and South America. A hydrogeologist, author of 15+ books, and lead Ashoka Fellow, he has held senior roles with IWA, World Bank, and IUCN, and is widely recognized for his contributions to water efficiency and environmental governance. Please put your hands together for Mr. Ganesh Pangare. And now I would like to hand over the mic to the moderator of this session, Dr. Indra Chakravarti. Over to you, ma'am. Let's welcome her with your round of claps.
Mr. Huan, after his speech, he will present memento to Mr. Jackson and Mr. Dilip Kumar.
After, at the end of the session.
No, after his speech. So I'll come and I'll announce.
Yeah, why don't you do it at the end of the speech, end of the session?
No, actually, I discussed that already.
Okay. Good morning, ladies and gentlemen. This is the only session we have on health. And I think the ultimate aim of all of us is to remain healthy, to be happy, to have a good life. So I think this session is critical. Whatever we are doing today, whatever public health interventions we do, whether it's water, sanitation, nutrition, agriculture, environmental management, what is the ultimate aim? The ultimate aim is that we should be healthy and happy. So I think this session actually goes into what our MC had said, that the first point is sanitation. If you don't have proper sanitation, what would happen is that you'll be polluting your environment, polluting your water, your food, your soil, your environment. And that leads to infection, microbes, pathogens, which leads to diseases. And what happens when you have disease? It's just not health. You have economic backup. You have to go to the doctor. You have to spend money on that. You lose your working days. Children lose their school days. So eventually, it's a whole socioeconomic impact which comes on a person, which affects his physical and mental health tremendously. So I think sanitation is the first point, and I always say sanitation and hygiene. If you have sanitation without hygiene, the coverage is not there. So I think this session is extremely important to consider that. And I think the most important thing I would especially like to mention here, that women are the most affected. It's very heartening for me to see that Sulabh has started projects on women, menstrual hygiene. And if you don't cover your women, your next generation gets affected. I think that's very, very critical. Because if you don't have your women healthy and happy, what happens? There's no safe birth. AIDS is easier to contract than anything else. You have urinary tract infection. Children who are born are not that healthy. So I think environmentally, I think it's extremely important that women's are particularly targeted along with sanitation and hygiene. And it's very heartening to see. I will not come into public health. I'll just come a little later. Another big problem with women. So I think it's very, very important that you target women, especially when you do sanitation, because they reflect your next generation. And I think that's very, very critical. Another point which was mentioned, and I think Professor Pasha will be mentioning from Singapore, the antimicrobial resistance. I think that is becoming a global, unprecedented, unexpected problem. What happens is when we are sick, we take medicines, antimicrobial medicines, which could be antibacterial, antifungal, antihelminthic, anything. When we take, for example, about 3 consecutive doses of many of these medicines, nobody wants to die, neither does the microorganisms. They don't want to die. And they're very good at genetic mutation. So they mutate themselves, and when you give them any antimicrobial agent like antibiotics, they don't die anymore. They're resistant to it. They're strong people, much stronger than we are. So they don't die. So what happens? We have a group of microbes now whom you can't kill. So when we have a disease and we take that medicine, it will not work. It will just be there. So what happens? And these microbes from the human body is going into our water, our marine life, our agricultural products, our animals, our soil. It's all over, all over. And so what will happen eventually? Our next generation, when they fall sick, you give them medicines, they'll not work. And as the minister from Africa said yesterday, that we want our children to come to our grave and give flowers. We don't want them to come and tell us, why did you do it, so that no medicines are working on us. When we are sick, we can't be treated. We can't get well. So I think this is a very, very important thing, and I think Government of India also has taken a bill about 2 days back on this, on what and what not to be used. But unfortunately, even now, if you see people take antibiotics at the drop of a hat, which is without any prescription, without anything. But we don't realize the harm that we are doing to ourselves first, and to the environment, to everything that's around us, and to our next generation. So I think I will expect to hear from you, Professor, on the antimicrobial resistance a lot. Lastly, I'll come into specifically India, some of the public health problems that we have not been able to tackle in the way that we always wanted to. Our surveys has shown that some of them are critically still there. One is the maternal mortality, death of a mother during birth. It is still very high. I think it's about 88. Which is still, most of the countries have a single-digit number, but we have a double-digit number, which is quite high, 88. So I think this is something depending totally on sanitation. Because if the mother is not, as I said, women have to be made strong. They should be, the maternal mortality it's mostly during infection and difficult childbirth. So I think this is something we need to look into. Infant mortality rate is 25. It's coming down, but not as we expected. Under 5 children's mortality rate is coming down, but not as we expected. Stunting and wasting, the 2 nutritional problems, are really not coming down that much as we expected. We still have more than about nearly 30% of our children who are either less in height or less in weight. And critically, diarrhea has not been decreasing. And all these problems, as you know, diarrhea is waterborne diseases. All these are related to sanitation. If you don't have sanitation, if you don't have hygiene, you cannot control infection, and none of these public health indicators are going to improve as we expect. Last but most important, I'll come to anemia, which is a very critical problem, which we don't have enough hemoglobin in our blood to carry oxygen. So women have a lot of problem, men have a lot of problem, children have a lot of problem if we have anemia. For example, anemia is extremely high in India. Unfortunately, more than 50% of our women are anemic. Pregnant mothers are highly anemic. Adolescent girls are extremely anemic. So at the start of their life, they started behind the line. So I think this is something which needs to be looked at. And why does anemia happen? Sanitation is the main precipitating cause. If you do open defecation, the worms are in the soil, and the worms can enter our body through the sole of our feet. So if you are bare feet walking, the worm will enter through the bottom of your feet, go straight away into your intestine, sit there, and take away your blood from directly on the nutrition. All the iron goes off. So therefore, I think it's extremely important, unless we have, earlier days when we were young, many years back, we used to always say, wear shoes, wear chappals in the villages. That was the main thing because the open defecation was rampant. So how would you protect entry of worm into your feet. He's wearing a chappal, he doesn't go through the under of your feet. But nowadays, we want to do it directly. We want to see there are no worms in the soil. And that can only be done if you stop open defecation. So anemia, the greatest public health problem that we have today, greatest public health problem. And we are ashamed of it, because India has one of the highest anemic problems in the country. I think they are going to do another survey very soon to see what has happened after Swachh Bharat and the water mission, whether anemia has come down or not. But simply with public health interventions, India has not been able to control. We have an anemia control program starting from 1972. Nutritional control has not helped. So I personally feel it is sanitation which is the crux of the problem. Anemia affects women much more than men. It affects the women and the next generation. So this is another public health problem. I thought none of us will be talking on anemia here, so let me talk on that. So I will end here. There are a lot of things that I can talk on health, but this I'll end here. Only to tell you that health is wealth, we always told from health, but when you look into any public health intervention, as I've given you a very brief on it, that unless you cover sanitation and hygiene along with that, it's just not giving a latrine. Along with the latrine, hygiene is very important. How to keep your latrine free of any infection, how to keep your environment, your hands free. I think all that has to go in together. And Sulabh, as I understand, is doing a remarkable job on that. Not just sanitation, taking on women's program, taking on other issues which links hygiene to sanitation. And I think that's a very critical thing that people have been talking about that. And I look forward to my panelists. We have 6 panelists here, all experts, 6 from 6 different countries. Mr. Pasu is from Bhutan, Mr. Acosta is from Canada, Dr. Verma is from Qatar, Mr. Lundgren is from South Africa, Professor Bauscher is from Singapore, and Ganesh Bangare is from Thailand. So we have 6 country perspectives in this session, and we all look forward, me too, hearing to them. We will first start with Dr. Pasu. When I start with you. Very briefly to say about Dr. Pasu, his introduction has been given. He comes from the only carbon negative country in the world. Only country which absorbs more carbon dioxide than they produce. So it's an only country in the world, and I think he should be very proud of it. So we want to hear from you that in this environment, your environment is so positive to you. You're very hygienic. I have not worked in Bhutan, but I got a lot of news from Mr. Payden, who used to be the WASH chief in WHO, coming from Bhutan. And she actually gave me a lot of eyesight into what Bhutan was. So being one of the most environmentally friendly country, we would like to know from you, Mr. Pasu, with this backdrop, with this positive environment that you have behind you, and you have an excellent intervention called the Toilet Revolution in your country, for which I think you've been also honored by His Majesty the King, has honored you on that. So with that, and you do extensive blogging and teaching based on that. So you have a lot of communication, as we were mentioning. You've done a lot of Toilet Revolution, along with that, a lot of blogging and teaching. So you have matched both of them. So what has been the impact on health? Have you done what has been the impact on health on the people of Bhutan? What are the indicators, if you think, if they've improved? Basically, the health indicators, please.
Good morning, everyone. Thank you so much for mentioning that Bhutan is the only carbon negative country in the world. Rightly so, because of the visionary leadership of our kings, who decided that Bhutan will always remain 70% under forest cover, is constitutionally mandated. And also there are many other very wise decisions which may not be quite good for our economy, but yet we have consciously chosen to do that under this great philosophy called the gross national happiness, which drives Bhutan's development philosophy. So that has actually taken care of a lot of things in the country, including health. Healthcare is free in Bhutan because of the same philosophy. So before I begin to quite answer that question, I'd like to mention that Toilet Revolution in Bhutan uh, from the civil society point of view, it may seem like it's the Bhutan Toilet Organization that we founded. But attending this session, I must mention that Sulap International has built the first public toilet in Bhutan. And only in 2022, they finally handed it over when we have declared ourselves ODF. It was exactly, I think, 30 years contract was over, lease period. So they handed it over, and that's exactly when we declared ourselves ODF. So it was Sulap that I must thank today. And Bhutan Toilet Organization, if you look at it, it's a name that sounds exactly like World Toilet Organization. So how I started was seeing Jack Sim and World Toilet Campaign online. And I was following him, and the name itself inspired me, and then I started it as a Facebook campaign to see, because Bhutan, even though it's environmentally very clean and everything, we have this popular joke, because we have a lot of trees, we go behind the tree and do, which is not something that environmentally friendly country wants to do. So I'd like to thank Jack Sim for inspiring me to start Bhutan Toilet. And not just inspiring me, he has guided me through and through, and I have attended two World Summits, and we constantly communicate, and he helps me gain good partnership everywhere. So that's how Bhutan Toilet has sustained and started this movement. So in health-wise, we have, like I said, we are not known for good toilet culture, because culturally we don't have toilet. So when Sulap started this, UNICEF and all started introducing toilet, it was something that needs to be taught to the people. So it's not even 40 years that we've been using toilet as a formal thing by everyone. So outbreak of a lot of diseases, life expectancy was also quite less. But today we have achieved so much. And I like to mention that it's the effort of a lot of organizations like WHO, UNICEF in Bhutan, Save the Children. But from the civil society point of view, from people, not the government, because it's always government that was, handing over to the people, and people did not quite, put effort from themselves. So it was us that we came forward and then asked people, it is our role to, play behavioral change, be it also bringing in private investment and all. So in all of these things, I think things are quite the same across the world, using mobile toilets, public toilets and everything. But Madam, recently my focus has been in the bedside toilet. That is one of my favorite one, even though moderator mentioned about Jimpa toilet, where I also encourage private businesses to open their toilet as Jimpa. Jimpa means compassionate offering. Because we do not have space and resources to build so many public toilets, I'm asking businesses, if you will allow people to use your toilet, we'll put a Jimpa toilet signboard, and that's your offering to the people. What do you get back? You get back footfall, and your business will run. And maybe some good luck because of your offering. So that's how it's working. But more than that, silently is the bedside toilet, madam. Bedside toilet is a toilet that you put next to your bed when you are unable to go to the toilet. So a lot of people, old age, disabled, sick people, and now the stroke is also rendering a lot of young people, not even very old, they are paralyzed and on the bed. So they need toilet. These are the silent ones, ma'am. They cannot even go to the toilet. So we are putting toilet next to their bed. But then I have explored the world and looked at all type of toilet. They are only good for one time. Because it's a bucket, they use it there, and somebody has to throw. So therefore, now I'm working on something that will at least last for one day. Where it doesn't smell, it will go in and there's no smell, something, nothing mechanical, because I'm going to use Lexel Corporation's Satopan in there, because Satopan is a very great technology with minimal mechanical technology there. So I have used this and tried once, but the shape and size didn't go well. So this time I came here to also thank Lexel Corporation and Sato Technology and meet them to now design this new technology so that those people who are already in bed, already in very bad condition, need not die because of sanitation problem. So I'll keep it here, ma'am. Thank you.
Thank you, Mr. Pasu. It's a pleasure to hear from you. New innovations that you're doing, and as we're saying, changing of culture is so important, and which you are a part of doing it in Bhutan, because you have a lovely environment, but I think at the same time, opentification needs to be stopped because of various reasons, I think. I think that's something that India has been pushing hard, and you have no opentification anymore, I think, now in Bhutan. I think so. I think it's a very quick action in Bhutan. They never used toilets 40 years back, and today they've reached an opentification status. So I think has been extremely fast and good, and I congratulate Sulabh for giving them the first sanitation, first exposure to sanitation. I think Sulabh has been a first in so many things. I think as we go on, we'll find out first in so many things. Now we have Dr. Acosta from Canada as our next speaker. He's actually a pioneer in portable sanitation. World over known for it, that he's very well known on portable sanitation. Portable sanitation is kind of a first aid tool actually for everything. It is for the most vulnerable population. I think it's very, very important, not only for big crowds where you use it, portable sanitation, but even for areas which have problems, like very arid areas. So portable sanitation is something which is very sensitive for large population, at the same time for the vulnerable areas. It's not only population vulnerable areas as well, I think. So I think this is to ensure that you have safe disposal of your sanitary products. So a very impressive tool. So we would like to know from you that, because you are dealing with a very unusual situation by portable toilet. So do you have any study, and how has it helped in preventing or reducing infections and helped in getting better health, if possible? A little bit on your what you do, and I think you have a small presentation. Yeah, and along with that, yeah. Thank you.
Hello, everyone. Well, thank you, Dr. Chabakri. It's been both an honor and a privilege to be here. I also want to extend my heartfelt gratitude to the World Toilet Organization and the Sulabh International for inviting me to be part of this important event. As we gather here today to discuss the critical issue of sanitation, I would like to share a perspective that is often overlooked but holds immense potential. Potable sanitation, and more specifically portable toilets, have a significant role in the prevention of wash-related disease and pathogens. It is time for the world to broaden its understanding and view potable sanitation as an essential life-saving tool. When most people hear the term portable toilet, they often think of a large public event like concerts, construction sites, and perhaps mining operation. But I'm here to challenge that perception. The reality is that portable sanitation systems are more than just a convenience, an event. They can be a first line of defense against some of the most dangerous wash disease affecting vulnerable populations around the globe. The systems that are not only efficient and affordable, but they are also environmentally friendly, a complete package that can save life and protect the planet. The portable toilet, as we know it today, has an interesting story. It was originally invented during the Second World to serve the needs of the soldiers in the field. These earliest units were made from wood and were strategically placed near the ports to ensure they were accessible and functional. In the 1980s, fiberglass replaced wood, making the toilets more durable and easier to transport. Fast forward to today, and modern portable toilets are constructed from high-density polyethylene and polypropylene materials that ensure long-lasting durability and easy sanitation with a lifespan of 15 to 20 years. Wash-related disease, those caused by lack of safe water, sanitation, and hygiene are a major threat, particularly in vulnerable communities. These diseases disproportionately affect people living in rural areas, underdeveloped neighborhoods, in urban centers, refugee camps, and other locations where there is no access to proper sewage systems to clean the water. Building infrastructure in these areas, whether it is water system or sewage treatment plants, can be prohibitively expensive, logistically difficult, or simply impossible due to the geographical or economical challenges. This is where portable toilets come in. These units offer a practical, cost-effective solution to sanitation crisis. They don't require a connection to sewage systems. I thought can be easily integrated into when available. Their more presence of portable toilets makes it inexcusable for people live without the proper sanitation, even if it's more criminal when we consider that life lost, especially children, due to preventable wash disease. Today, we have the tools to make real difference. Portable toilets can act as a first aid kit, a temporary but crucial intervention that helps prevent and spread of the disease, saving lives and protecting communities. To give you an idea of their practical application, on average, one portable toilet serves 10 people, with each person using the toilet up to 3 days. Typically, TAN has capacity of 80 gallons. Depending on the model and the cleaning procedures, a portable toilet typically needs to be sanitized every 3 to 5 days. The portable sanitation industry is not just about providing toilets, it's about providing a complete sanitation solution. This includes the regular cleaning and disinfection of units. In the past, cleaning products used formaldehyde, but we come a long way. Today, we have environmental friendly biological safe products such as biocides and bacteria to ensure the sanitation efforts are both safe and sustainable. To facilitate cleaning companies as a vacuum trucks, to remove the waste from units, these trucks collect both liquid and solid waste, and they were equipped with software that helps track inventory, monitor cleaning schedules, and ensure efficient operation. This allows companies to maintain high standards and hygiene and improve the service delivery. Once waste is collected, it's taken to a water treatment plant where both solid and liquid are treated. The treated water can be safely used for various purposes, while the waste can be converted into natural biological fertilizer. I have seen this model across the United States, South America, and Costa Rica, and it's clear that it's a viable business model here. Whether it's one company managing the entire operation or multiple companies working in partnership, the potential of sustainable, profitable operation is vast. And each step in the procedures from collect to treatment can help create a healthier world. To wrap up, potable sanitation might not be the first solution people think of when they consider fighting wash disease, but it should be. It's an efficient, sustainable, and cost-effective way to protect health, reduce disease, and protect the environment. As we move forward, I urge all of us to recognize the value of the potential portable sanitation in transforming lives. We have the tools to make the real impact by prioritizing access to safe sanitation. We can save lives, protect the planet, and build a healthier future for everyone. Thank you.
Thank you so much, sir. Here, I would like to pitch in a little bit because since we know that Mr. Juan Carlos Acosta is the founder of Thermoform Portable Sanitation Solution, so he has got the models of those portable sanitation solutions with us, and he would like to present it to the president of Sulabh International Social Service Organization and the founder of World Toilet Organization. I would like to invite both of them on the stage, Shri Kumar Dalip and Mr. Jack Sim. I request you to please come on the stage. Maybe please have those portable sanitation solution models over here. Yes, one by one they are going to bring it, sir. So here we are presenting it firstly to Mr. Kumar Dalip, the president of Sulabh International Social Service Organization. And now we are having this another model for Mr. Jack Sim, and it is matching with the attire that he's wearing today. This is the presentation to Mr. Jack Sim, founder, World Toilet Organization. Let us have a group photograph. Thank you so much. With this, again, I would like to hand over all over this dice to Dr. Indira Chakravarti. Ma'am, over to you.
Thank you, thank you. I think it was a wonderful talk that we had from you, and also demonstration, I think, when you gave it to them. So it's very small, but it's functional. Size-wise, it looked very small to me. The portable sanitation, how do you use it? Isn't it? It looked very small to me.
Well, I brought him on after the show because the time is limited. I can explain each one, the three technologies that exist currently today in portable toilets. It's like the latrine, the flushing one, and the freshwater one. And based on the technology that it uses, we will be able to control the bad odor in each one and the control of the gases. So my suggestion, it will be the freshwater one because you will be able to control odor, right? And you won't be mixing the waste continuously generating gases, right? Also, however, they all work perfectly.
Does it disinfect also?
Huh?
Does it disinfect also?
So yeah, so the advantage of having a portable toilet is that they could be pressure washed, right? And they could be disinfected every time they get cleaned out. Also, one of the biggest challenges that they don't have in other countries that they have in Canada is that the waste get freeze, so you're able to control even the waste, even if it's freeze. So that's a big challenge that they don't have in other.
We'll go later into discussion.
Exactly. So I invite you after the show to come see me. I can explain you step by step technologies, products that they use in order to operate them correctly. And yeah, I'm a big fan of portable sanitation.
Thank you. I would like to waiting to hear who's a lot of innovation and technology behind this work, a lot of work that we are looking forward to you. Dr. Lundgren, you wanted a brief presentation as well? Yeah, did you want to make a brief presentation? Yeah. So he wanted to fast track the SDG 6.2.
Hello.
So I think his innovation and new technology development is something that, and I'm sure you will talk, not your shirt says.
Yeah, no, I will talk shit with you today. Hi, good morning, everyone, and thank you for being here. It's an honor, and thanks, Jack, thanks, Kurat. It's fantastic. I just want to, we talk about toilets, and everything is about toilets and shit, okay? So I want, what's most important when we talk about the toilet, when we come to the toilet? Is it that clean? Hand up. Okay, clean. Okay, hand down. Smell? Oh, there's someone likes it when it smells. Okay, I can see that, that's fine, okay? If we take the flush, when we do the drop down into the water, okay? Is that important? Is it important that we shit in water? Hand up. Yeah, yeah, some of you. And is there someone that likes when it hits the water and splash up the bum? Hand up, someone likes that? Yeah, it's one, okay. When I've been in software all my life, mostly since I started working, and came into sanitation by accident, actually. We had a drought in South Africa 2019, and we have something, they call it 50 liters per person a day for washing, drinking, flushing, and we have a toilet that uses 9 liters of water. So people started saying, if it's yellow, let it mellow. If it's brown, flush it down, okay? So the whole house was smelling of urine. Is there someone that liked the smell of urine? No, either I. So here's one here, the same guy who liked the splash. Okay, what's happening was that I just ordered a low flush toilet from Sweden. I'm from Sweden, but I live in South Africa. And it uses an average of 1 liter, so we could flush all the time. And suddenly I was into this shit business by accident. So we started to import some toilets, come in contact with the school, and the school had like full pit latrines, and the kids were pooping outside the school. And they said, can we use your toilets? And they didn't have water all the time. You can use a flush toilet without water, but it ends up in the pile, and it's very difficult to clean after a while, right? And the company we work together with in Sweden have a dry version, a small flush for urine, and the poop goes into a container, so you don't need water. So we installed it, and it works fantastic, okay? But the problem is not the toilet. The toilet is actually shared with a hole in, or if it's a urine separation toilet, it's 2 holes, okay? The problem is the shit, okay? And I thought in the beginning of this that a wastewater plant cleans water. So you put shit in one end, and you have drinking water on the other side. No. All the nutritions from urine, potassium, phosphorus, etc., goes into the ocean. And the fish hates it. The coral die of it. So why are we just putting it into the ocean? We should put it into the soil. Because vegetables, trees, worms in the soil loves it. I will just finish off with a small story about diseases according to sanitation. And one of the things I found quite early was something called neglected tropical diseases. How many have heard about that? Okay, good. Just few, and most of you guys are in the sector. Anyone heard about the guy called Ascaris? Okay, I will tell you about Ascaris. It's a little egg that spreads in rural areas, okay? And you can't see it. It can be on the fruit, can be on salad or a tomato, whatever. And what's happening if you get that little egg in your tummy, it creates a worm. But the female can produce 200,000 eggs the first 24 hours. It's only 80,000 people a year, according to WHO, that die of it. So it's not a big deal, right? Then you have like diseases like Bilharzia. Anyone heard about Bilharzia? Yeah, I heard about it. The interesting part there is, like, when I find out about this, if you are a female in Africa or in a rural area, and you have intimacy or sex or a shag, it's fire from hell. It's fire from hell. And it's because of pit latrines leaking into the water. It's because fishermen in Victoria Lake, when they're fishing, they put their bum out of the boat and shitting in the water because the fish coming to thinks it's something good there. And maybe it's good. I haven't eaten shit, so I don't know. So I will finish off with a story about Anita, a nurse she has been on her CV on every Ebola district in Africa when there's big things going on there. And she said, like in medical clinics where they don't have toilets or pit latrines, the staff goes to the toilets, the patients goes to the same toilets, and they walk in fecal matter, bring it in to the clinic, and people get sick because of that. And what's happening more is like this newborn, they told the women that will give birth at the clinic. And what they find out is newborn are infected because of bad sanitation. So the dialogue flies. So we need to improve sanitation in healthcare. And the first conference I was on about healthcare facilities, it was like everyone was shocked. Because if someone of the staff get sick, suddenly they are super spreaders. So they spread diseases to other people. And you go to the clinic you want to be healthy. And you don't get healthy, you get sick. So I'm going from software to shitware. And was fun to speak about shit with you. Thank you.
Thank you very much, Dr. Usha. I think with all his humor, and we all want to be happy, as I said, with all his humor, I think he touched upon something very important, uncommon tropical diseases, which is actually a great problem for the entire developing world. And as you know, WHO has formed special groups on that now. So I'm very glad that you touched upon this very, very important issue, and but full of humor and fun. I think that's very important in life, that you touch upon the most difficult issues with lot of, what would they say, not feeling sad about it, but feeling happy that how do we control it. I think it's very, very important. Thank you very much. We now go into, we have been waiting to hear from Professor Bausha. I think we really look forward to hearing from you, because you are a completely One Health person. We've been talking of One Health, WHO, for a long time, but I think One Health is a very important way. You think we are living in a planet, which is one planet, and all of us are living together, sharing with each other, with animals, marine life, dogs, cats, we are all in one world, so it's a One Health problem. So we need to interact, help each other, support each other, see to it that all our health factors are matching. I think he's one, you are the one who's working on a lot on One Health issue, which is very critical. And I think you are looking into, as is on the scientific knowledge and information of the pathogens that comes into human body, and how does it impact on the environment. I think that's something very important, that human body environment interaction, which you are focusing at. And I think it's very, very important today in this world when we are polluting our world around us. So how do the pathogens developed by us is affecting the environment? And I will also like to hear from you on the antimicrobial infection, which I spoke briefly about, because this is very much linked to the antimicrobial infection rates. So to you, Professor.
Yeah, thank you very much, and thank you, WTO and Jack, for inviting me here, and Sulabh for putting this great event together. My wife and my daughter always complain when I talk about poo at the dinner table. I was banned from doing that, but here it's all okay, so I feel very comfortable. So you've raised a lot of important, challenges that go with with infectious diseases, especially gastrointestinal infectious diseases. I've been working in Bangladesh since a long time, 15 years, mostly in rural areas where they have very poor sanitation. And it really changed my outlook on how I understood infectious diseases. Because we often talk about people going to hospital and they being infected with a bacteria, but it's not actually that simple. Actually, people that are not sick can carry the pathogenic bacteria. For example, I just finished a study in Bangladesh, in Madbaria village, it's a coastal village, and where we worked actually with Reckitt, and they funded this study, and we built some rainwater tank, because in Bangladesh, I mean, many of you maybe know that, because in Bangladesh, you can't dig a well because there's lots of arsenic, like in parts of India, in the soil, so you can't drink the water. So they dig very shallow ponds that accumulate rainwater. But this is very easily contaminated because there's no wall, and often people bathe in it, animals go in it. So it's very easy to contract diarrheal diseases. And in these villages, we built some rainwater tanks so people would have clean water. We took 70 families, and half of them, we gave them a water tank at the beginning of the study, the other half at the end of the study, and we wanted to know how their health would improve and how what they carry in their gut and their intestine would change if they wouldn't have pathogens. And what we found out, actually, is that the people there carry pathogens with them all the time. We found about half of them, even though there was no cholera outbreak, half of them carried the cholera pathogen. A third of them carried Giardia, which is a parasite. 20% of them carried Shigella, the dysentery bacteria. Many of them carried Campylobacter, which causes this long-lasting diarrhea. There's many different types of diarrhea, right? This one is the slow burn one, right, if you've ever had a Campylobacter infection. So I realized that actually people carry these all the time, and the people themselves are a reservoir if they do not have access to good sanitation. And after being here, I thought, oh, I should have done my study, but people with toilet and without toilet instead of water tanks. So maybe the next one I'll do that, because I think it would make a huge difference. But it's not only in places where there's poor sanitation that there's issues with carriage. For example, I also do studies in Singapore where I look at acute diarrhea, because we don't even know what causes it 50% of the time. Even if you go to a hospital, most of the time people don't do tests, so we don't know what causes it. But screening, we had some nurses volunteered, to give a stool as healthy side of the experiment, because we control healthy versus people with diarrhea to see what they had. And even the healthy nurses were carrying all sorts of pathogens, like Yersinia or Shigella, the same thing. So it's also a profession that maybe puts you to risk to carry these diseases. And like Berger was saying, once you carry them, you can spread them around, right? And sometimes you can't tell because you're not feeling particularly bad, but you're still carrying the disease. And to come into AMR, and yesterday they were talking about climate change, I don't think actually people realize how tightly linked with climate change gastrointestinal diseases are. I've done, so this study in Bangladesh, I was looking at this pathogen called Klebsiella. You might not have heard of it, but it can be very serious. One of my colleagues is actually Indian, but he works at the university with me in Singapore. And he got a Klebsiella infection, and these are very, very commonly antimicrobial resistant. They're one of the most common ones. And he spent 20 days in hospital with this infection. They had a very hard time treating it. And when I was looking in the village in Bangladesh, actually, the number of people in the village that carried this bacteria in their intestine was directly related with the outdoor temperature. So the warmer it is, the more chance you have to carry this. So there's a very direct impact. Even in Singapore, where you think, oh, it's on the equator, it's always hot, right? Or maybe the temperature varies between, 31 and 35 degrees. There's a monsoon, just like in India, there's a monsoon effect. And when the monsoon goes and the temperature rises by 2 degrees, you see the infection rise by as much as 20%, all gastrointestinal infections. So even in a country that has very great sanitation, it's still, the climate has a massive, massive impact on the rate of these diseases. And because bacteria that carry antimicrobial resistance like Klebsiella are driven by temperature, then you can see how the climate can encourage these antimicrobial resistant infections. But I've also studied other things. For example, my first study on cholera was the outbreak in Haiti. Maybe people don't remember. That was in 2010 after the big earthquake, right? We studied that with the CDC and the Center for Disease Control in the United States that, most people have been fired now, 90% of them. And my colleague there do some very important work, but it's quite unfortunate because I've been doing some studies with them, and even in the USA, we've been showing that not the pandemic cholera, but other related bacteria that are also called Vibrio cholera, the same species, they are rising so fast because of climate change, because the water temperature is increasing very fast over there. 17% rise per year. I mean, do you know of any diseases that increase that fast? So the climate impact is not slow. It's very, very fast. Every year there's a difference. So this is something to think about, as we're trying to adapt to the climate, that it's linked to all these different things. How the bacteria spread, what we carry in our gut, and then, we might become spreaders. So these are some of the things that I've been thinking about, and that's why sanitation becomes even more important in a changing climate, because it's a catalyzer for all of this, right? Yeah. Thank you.
Would you like to talk very briefly, a couple of lines on antimicrobial infections? Would you like to say something very small?
I've got some experience with it with cholera in Bangladesh, because they take really strange cocktail. I would visit some cholera hospital, and then you can see the mother with her son, and she said, "Can you tell me what you're giving him?" And she opens a bag, and I see 3 or 4 random antibiotics, and it's understandable. She's going to give whatever she can find to her son so he gets better, right? But you look at the cocktail, many of them are not effective, and then you know that by giving these antibiotics, it's going to create resistant bacteria, and then they're going to spread around like you were mentioning earlier. In Singapore, for example, we have a massive problem with antimicrobial resistant infection in the hospitals. I mean, Singapore might be a clean and wealthy country, but we are a hub in Southeast Asia, so everybody travels through, and they bring their microbes with them, like I was telling. And we have all these antimicrobial resistant infection, and some of the time you work with patients in a hospital, and they get these chronic infection with the bacteria that you just cannot treat, right? So you have to find alternate ways, and we're working on different things like phage therapy. So these are viruses that actually don't kill humans, they kill bacteria. They're very specific. So there's novel things like that can be used. And one of my friends, Dr. Andy Kimili from Tufts University in Boston, he works a lot in Bangladesh as well, and he's doing phages to combat cholera as a prophylactic. So there are some solutions, but some people are pretty desperate. I remember one of my friends, she got a cut on her foot, and she was in hospital in Australia, and nothing they were doing could treat it, and she thought she was going to have an amputation, right? Amputation, we think it's something of the past, but it's coming back because of these things, right? Because if they cannot treat it. So it's a very, very complex problem. I was just at a symposium last week on this in Singapore. Very complex, because there's not only, the research in developing new drugs that don't make money for companies is very hard to push that. There's also the misuse, of antibiotic and misprescription. There's also, because for example, even in Singapore, 50% of people think that viral infection can be treated with antibiotics, which they cannot. Right, and doctors still prescribe it to them because they ask the doctors, I want something. So the doctor feels pressure and they prescribe it to them. So if we had better diagnostics, you can tell the person, actually, look at this rapid test like during COVID, you don't have a bacteria, you have a virus. I'm not going to give it to you. Then the person would accept it, right? So there's a lot in the communication as well. So it's a very, very complex problem. And it just like sanitation, it has to be a multi-sectoral private partnership approach to solve it. Yeah.
The only way to stop this imminent problem for our next generation is to give proper sanitation and hygiene so that we don't get infected and we don't have to take medication. I think that's the only solution to this problem. Unless you stop getting infected, repeated infections, if you can't stop repeated infections, we are very unsure of what future holds for us. Repeated infection has to be stopped, and I think sanitation and hygiene is the only way to do it.
You're making a good point, because some of the prominent speakers, what they pointed out is actually the development of vaccine for Streptococcus. it was the biggest effect on the drop of antibiotic use because the vaccine, the infection were not happening, so it was a drop. So that's a very good point, yeah.
As a matter of fact, Bangladesh has been doing quite well, much better than what India has been doing. I've been involved in South Africa, Bangladesh, working with them quite a bit. I did their National Plan of Action on Health also for Bangladesh. And as a matter of fact, people in Bangladesh about 10 years back, the next generation was more stunted than the previous generation. I mean, the next generation was shorter in height compared to the earlier generation. Where all over the world the height is increasing, in Bangladesh the next generation the height was coming down. But now they've totally reversed it. Now the next height is much taller, the recent generation is much taller. So in 10 years they've reversed the whole situation very well. So I think they are, and they reflect, as you know, the diarrhea control is also by far better. So unless we control diarrhea, unless we control, as you mentioned, the tropical diseases, unless you control these diseases very carefully, it's going to be a very difficult place for us. And I say again that sanitation, I think, is the magic word which can only do it, sanitation and hygiene. So health cannot stand on its own feet unless you give it proper sanitation backdrop. That's very, very important. Now we come to Dr. Sunur Verma, a medical doctor. He has extensive global experience in various settings and worked with various agencies. I'm not mentioning all of them, but a wide experience. He is also in the health policy advocacy with the Qatar government. So he's been doing a lot of work on public health and especially advising the government in Qatar, and also he's been working in many parts of the world. So, and Dr. Sunur Verma, if I may mention, is also, I think, writing some volumes on Dr. Bindeshwar Pathak. So he was also involved with Sulabh, and he's been following the work of Sulabh quite a bit on the sanitation and health. So we look forward to hearing from you, Dr. Verma.
Well, thank you very much. You heard a lot about infections, and you heard about anemia, you heard about antimicrobial resistance, etc. Big terms, big concepts, but actually very simple. So infection prevention is not rocket science. It is just about stopping a germ from moving from one person to another. So how do you stop that transmission? That should not be rocket science. It's simple. Hygiene, running water, and sanitation. These are the three established norms. However, when you go at international meetings and conferences, there's constant discussion about why infections. That is all very well established. I feel that we really need to shift towards the how part. And I think at this summit, that has been a very strong focus because we have had practitioners share their experiences. Now, how many of you enjoy cooking at home? If you'd please put your hands up. Great. How many of you are passionate about ironing clothes? You enjoy ironing clothes? All right. How many of you enjoy grocery shopping? And how many of you enjoy cleaning the toilet at home? So this is a very passionate group of toilet cleaners. Excellent. Now, this is worthy of a big applause. Now, if this would translate into the policy arena, that would be great. Now, toilets is an orphan issue in the policy arena. Who is responsible for toilets? Ministry of Health, Social Development, Tourism? Who is responsible? So it is an orphan issue. And that is what you also see in families, that when it comes to toilet maintenance, you hardly ever get a volunteer, right? Now, there are three issues I would like to raise in terms of preventing infections. You heard the clinical, medical side, research side of it. I would like to talk about three issues. One is competence and leadership. Second is partnerships. And the third is self-sufficiency or self-reliance. So when we start with competence, yesterday Dominic highlighted India's achievements in sanitation as an outlier because it was a mission which was launched at the leadership level. It was articulated very clearly at the leadership level, which forced the ministries to come together around a mission. Now, a mission is something that has a target date and a time period. The question is what happens once that mission is over and the country shifts its focus to another strategic objective. And that is where the question of competence comes in, of how the government hands over the mission to civil society, to organizations such as Sulabh, to carry it forward to make it sustainable. It is not a coincidence, those of you who follow Prime Minister Narendra Modi, that in many of his public speeches, he has specifically mentioned the work of Dr. Bindeshwar Pathak and Sulabh International. So we need to be cognizant of the fact that leadership needs to articulate who is competent, so that torch can be handed over. So that is number one. Number two is in terms of partnerships. During the last 2 days, we heard a lot about private and public partnership. In fact, private-public partnership has become a mantra all over the world now, which is good, because innovation to a large extent can come from the private sector. However, we should be careful and think of what is known as the social contract. When I vote for a government, the government has obligations to me as a citizen. Right to health is one of these obligations. We cannot shift that task to the private sector. So there are certain things which need to remain in the public sector, and that public sector needs to be strengthened and built periodically. And the third thing is self-reliance. Now, how many of you remember COVID-19? How many of you lost someone close or someone you know to COVID-19? One thing which we seem to have forgotten about COVID-19 is how desperate we were to get vaccines. And that was a time to test friendships. Many of our friends as countries who had promised friendship forever until death do us apart suddenly were not giving us vaccines. There was vaccine hoarding. And that is where India stepped up. Because India had invested in self-reliance in terms of research and development, and India went forward and provided vaccines to many other countries, not just in the neighborhood, but around the world. Now, I would like to connect this point of self-sufficiency to development aid. Now we see a lot of funds have been withdrawn by countries like the US, and many NGOs, including in India, have just collapsed. The exception is an organization like Sulabh. Now, anyone serious about how development work happens needs to very carefully study the example and case study of Sulabh. Because it is made in India, it is made for India, it is made by India, and then it is shared with the world. So when it comes to sanitation, once again, that self-reliance is absolutely critical. So building that critical mass of knowledge, research development, and that very strong partnership of civil society with government. In this conference, we have talked a lot about, once again, the private sector collaboration, but we have not talked about the civil society collaboration of organizations which really understand the fabric of communities and societies. So in summary, Dr. Chakrabarty, I would just like to say that infection prevention now needs to move in the zone of action because the evidence is all there. So discussing how to make it happen at the country level and how to sustain is critical. And just one point I would like to reiterate of what Padma Shri Dr. Chakrabarty said was the inclusion of women. I know our panel really is not representative of women, so this message coming from here may not be appropriate. However, unless women are included equitably in all our efforts, none of what we do will be sustainable. And once again, this is where Sulabh is highlighting. And the last point I would like to make is, why did Sulabh succeed? Those of you who do a study on Sulabh, and also Mission Bharat, because it moved away from talking about sanitation as sanitation, it equated sanitation with human dignity. So it is truly a path of empowerment. In our development sector, we often throw around the word empowerment very casually, as if power grows on a tree. So you pluck power and you hand it over to the next person. That is not how it happens. You have to relinquish your power and hand it to somebody else, and that is how empowerment happens. And I'm very happy that at this summit, we are seeing empowerment in practice through the people we are meeting, the people we are networking with. So a big round of applause to Sulabh and the World Toilet Organization for doing this. Thank you.
I think, Dr. Verma, we've been talking that sanitation is the main thing to improve health. I've been telling that from the morning. But I think, as you said, there cannot be a better example than Sulabh. Because Sulabh is an organization which I may say in a very old word of one of our freedom fighters, it is by the people, of the people, for the people. It has been, that's why Sulabh will stand on its own feet no matter what. And as you know that when Sulabh started its movement on sanitation in 1970s, nobody even talked of sanitation. They didn't know why are they talking of sanitation? What's sanitation all about? See, 1970, we've had the Swachh Bharat movement which came on later on in 2014, but the main seed was laid, as the minister himself mentioned in the inaugural speech, was laid from 1972. And I think they've done very remarkable work. I've gone through some of their work. So I think Sulabh is an organization which has shown on ground that sanitation and health, I'm talking on the health issues, but they have talked on why sanitation and health is so important. Socioeconomic development, human dignity, health, everything has been put together by Sulabh. It's not just one single issue of how to help the people who used to deal with the sanitary products, how to employ them, how to teach their children, how to make them educated. So the next generation who is to be the scavengers are all doing so well. They're all well settled, well placed, their children. So I think this is a thing, looking into your next generation, looking into the stability of the people you are dislodging by building sanitation is something which nobody ever thought of. And I think this is something which Sulabh has been doing from the beginning. And I think what Sulabh is now doing, as you mentioned, women. Sulabh has taken on the women's program in the last couple of years, just recently, very recently. They've also gone into, if I may mention here, food security. They've gone into a lot of food security issue because it's understandable that along with WASH, nutrition is an important component. And along with food safety. So I think the new developments, the dynamicity of Sulabh that's happening from very, they started talking of sanitation when nobody spoke of sanitation, but now they're linking sanitation to other issues that you mentioned, women's issues, food nutritional issues, food safety issues, millets, as I can mention here, which is something which is very important for us. We had moved away from natural nutrition. We are coming back to it. So I think it's extremely that you mentioned, Sulabh, I couldn't stop mentioning.
If I just may add to what Dr. Chakrabarty is saying, is one fun fact. How many of you have read a book called Poor Economics? Mm-hmm. So there's a couple from Harvard, Abhijit Bhattacharya and Esther Duflo, who came up with this study which won them the Nobel Prize for Economics. Right. So in that book, they won the Nobel Prize for identifying that poor people comply better or take up services when they pay for it, they value it. Now that is something that Dr. Bindeshwar Pathak figured out in the 70s with the pay-per-use toilets. And one more very important fun fact, because it goes to the center of the issue of values. The founder of Sulabh chose not to patent his technology. And today the world is run only through patents. So that shows the social thinking of the issue. And I think that's a critical point which is understated, that Sulabh chose not to go for patenting.
Definitely,
thank you.
Definitely. No doubt. No doubt. If I can, thank you, Dr. Maria. Can we move on to Mr. Ganesh Banghare now? He's worked across the globe with nearly every important agency, which I think our MC had mentioned, on WASH, climate change, water security. What we would like to hear from you, Mr. Banghare, is that when you have worked a lot on islands, on unusual places, as I mentioned about you working in very vulnerable areas, He's been working a lot on islands, as I understand, in the Caribbean, in South Asia, all over the world. So in island situation where we know that the water is saline and the soil is porous, sandy soil, in such situation, how have you been sort of looking into the sanitation issues and water safety and its linkage to health? Because that's again in a very unusual condition. So I think this is something we want to, nobody has been speaking on these islands and coastal areas. Second thing, I think I'll put a second question to you before you finish, but we save time, that you've been working with the European Commission on developing non-invasive, after it came after the COVID, non-invasive surveillance of early detection of diseases that are linked to WASH.
Yeah.
So can you give us a little inkling on what the European Commission is doing for early detection of infections? Both the questions are different, but I
Yeah.
them together.
Thank you, and I think I'm the odd man out, or odd, in this whole panel, is that I'm a pure water resources professional, and first of all, I'd like to begin by, thanking Sulabh, WTO, and of course, I'm here again with due respect, is because Dr. Indira Dee said you have to come, and I said I can't say no to her because a lot of the things I learned on health is from her. So.
IUCN. So we have been working together for IUCN, other World Bank and other organizations together.
Yeah.
So world over,
Yeah. So, but before I really begin, I think we have all, I would like to pay respect to Dr. Bindeshwar Pathak ji. We all know that his work on sanitation and the many awards that he has got. But बच्चे बैठे हैं यहाँ, मैं उनको कहना चाहूँगा कि आप जाके गूगल करना और ये मैं बोलने के बाद एक सरप्राइज टेस्ट भी होने वाला है. So the point is I'm trying to make is that even the water community, because that's what I belong to, felicitated and gave the highest award to Dr. Bindeshwar Pathak ji, that is the Stockholm Water Award in 2009, which is the equivalent of the Nobel Prize in the field of water. I think I thought it was important to mention because everybody is, talking about Sulabh in terms of, the sanitation and hygiene, but, even the water community globally, in 2009, and I was there and, part of Stockholm Environment Water Institute, and I still remember him in his black Bangala jacket coat. So, we have these privileges of meeting some of these people that you learn from, and that's how you grow in life. So I think for the kids, when you go back, please Google the Stockholm Water Award and Dr. Bindeshwar Pathak ji, okay? It's a promise? Yeah. Okay, so quickly coming now to, as I said, we've been talking about large areas, but one of, the islands, what is not seen is forgotten, or, in that sense. So I'm not talking about Singapore, where Jacksim comes from, where, the water that you flush down today, tomorrow you can drink as drinking new water. I'm not talking about islands like Singapore, but what I'm going to quickly give a overview is the Pacific Islands, the Caribbeans, the Indonesian islands, the Southeast Asian islands. I think that's really important. Number one, there is no sanitation without water, so I'm not getting into the details, but the island countries, you have to understand, are very fragile and lack of fresh water. That's number one. That's a very important point. And the second is, therefore, the stress that comes about. The second is, I think the session, which again I said it was really important, is because you're connecting health, water, and then sanitation and breaking the cycle, as you said, for infection. And this really applies to the island countries. I'll come to that, how it is completely linked. And the second is, most important is that, and I was very happy that a politician, the minister from South Africa mentioned it, and it was really music to my ears, is that when politicians really talk that environmental degradation is linked to poverty and, the health. And therefore, when we talk about water wealth, and as you said, is both. It is the health of the ecosystem and the people. Let's not forget that. It goes hand in hand also, because nobody talked really that we also have to have a very good ecosystem or our nature. Both are connected, and that's the point. Thus the health, and again, to this audience, I don't need to tell the linkages between poor water, water quality, and health. So let me move to a couple of things. As I said, time is short. Just to give you a quick flavor. One, what is the availability of fresh water in island countries? It's really small lenses of groundwater. They don't have big dams, big rivers. So please understand that. So there are small groundwater lenses, which are very shallow depth. The second is small ponds, open ponds, and small streams. And the third, very important, is the rainwater harvesting, which they do, which is being used. You know, we had agreed that we won't have slide, but I always like to show a slide from Majuro Island. You won't believe it. Where will they harvest the water? Because they have very small land. The runway in Majuro Island is used to harvest water. So in there, once a week, the plane lands, and the whole runway is used to harvest the rainwater. There are tanks below, and that water is then supplied to the town. And they wanted to increase the frequency because once a week it's really less. But they can't because, how do you then, where do you store the water? So what I'm trying to say is that how things are linked, and we have to understand that. So, the second point is for people, when we're talking about, India, Bhutan, yesterday Nepal has become open defecation free. We still have at an average of 20% of open defecation happening in the Pacific Islands and many of the other islands. And 20% when you say average, some places it's even more. And again, I will link it to it that because, as I said, some islands it's very difficult for us to understand that it's only a football field area, for example. And if you're doing open defecation there, your groundwater, the lens is shallow. I don't have to explain again what is happening. The whole shit is going down and to the water, you're drinking it, and therefore the health issues coming up. In fact, again for figures, not even 20% of piped water supply is there in these island countries, even less than the sub-Saharan Africa. So this is not talked about. I think this is really, really important that we need to go ahead with. When we come to sanitation, because I think one or two small points about sanitation I do have to mention, is that majority, if you leave a little bit of urban Fiji or a little bit in Jamaica, some towns, most of the drainage is unsewered or it is decentralized, a system that is pit or septic tanks. And I just mentioned that 15% population still in the Pacific Islands open defecation, and up to 70% to unimproved sanitation facilities. So it's so large. This is not highlighted a lot, and that is where it's really important that we need to have the linkages between therefore coming water, sanitation, and what's happening. And I was very happy, and this is something you always learn new when you come, and that's why you like to come to meetings like this, is what Jan said, and also we talked something last night at dinner. But Jan mentioned climate change and the increase in bacteria happening. I was going to say that climate change, the IPCC, as we all know, has said that the most vulnerable nations in the world are the island nations to climate change because of sea level rise, storm surges, ground saltwater ingress. And the fourth point I think I'll make from my next talk is what Jan said, also the bacteria, the diseases with the warming of the temperature, which was a very important point that you made. Thanks, Jan, always good to learn. Coming to health, that is what Indira Di had said I should be talking about. Again, if you look at Kiribati, more than 47 deaths per 1,000 kids born. Again, diarrhea, cholera. So I'm not getting into, so there are many, many diseases. One, because of time, I'm going to say is very important. We all know that there is cholera happening, diarrhea because of, and the linkages, as I said, it's direct sewage being put into the water. But we don't realize that in island nations, and this is a large population, they are depending on the shellfish and the fish they eat in the small ponds and things around. It is really shocking, and I've not seen many papers or people talking. There's some academic papers, but the linkage people are not doing is they always relate water, diarrhea, septic tanks, and something with all the other diseases we talked about. But the main thing is we realized is that the shellfish are having a lot of heavy metals and other diseases, and we saw a large number of miscarriages in women, kidney failures happening, which were not directly first correlated to the water and wastewater which was going into the food they were eating. And this is again not for island, but also if you look at Jakarta, you look at many. So when you said, Dr. Indira Di, when it's food security also, we have to understand this fact that there's a direct link between water, food, and the intake we do. So let me, I think, stop here, and in a happy note is that what is happening. So the new thing that are happening is that now people have realized that let's start mapping where the toilet will be, where is the groundwater lens. Simple things that somebody said. We sometimes don't need, the person before me said, we don't need large rocket science, but let's start understanding that if this is your small groundwater lens, then therefore let's not build the toilet on that, or how we can go a little away from it. What are the new technologies that are coming up that can be used? And therefore, a resilient agenda for the islands would really have to really look at the nexus between water, health, and sanitation. Thank you. If 1 minute is there, I will, if the slide comes up, I'll just mention. Yeah, 1 minute, because that's not my work. So.
That's gone, they've already
Yeah.
Is
the slide coming
there.
up?
Slide is already
Yeah.
there. People have seen it.
No. So basically, this is the European Commission work which started in 2024. If people want to know more about it, I'm quite happy to link you with the organization in Europe, European Commission, the Joint Research Committee, which is doing it. This is water environment surveillance, and show the next, because I think that's what important. So what this whole study is, how do you prevent before any big disease happens? The money was put into this because of COVID, as people mentioned. The environmental surveillance program has just kicked off, but what is important here is that there were 3 pilot studies, Munich Airport, Osaka, and Madeira Island in Portugal, but this is something for, last point is for Sulabh, is that you have, in Pandharpur, and we have the Kumbh. We have to also start this in India. That's the point of how do you start doing environmental surveillance to see any disease that comes up. That's all this is.
Thank you.
Thank you.
I'm not, I think we have had interjections in between amongst us about what's happening. So I'm not summarizing, but using the last 5 minutes for any questions that you may ask to any of our, you've got a wonderful panel here with such a wonderful expert group. Any questions or any clarifications from the audience, please? Any clarifications or anything else that you would like to know? Or do you think they've spoken all that you wanted to know? You think they've spoken all that they wanted to know, nothing else to know? So would you like to say anything in the next 5 minutes, any one of you? Would you like to say? Yeah, please, sorry. Can you please introduce yourself?
I am Professor Neil Rathan, Sulabh Sociology of Sanitation. What is coming out from this, which is something very depressing and negative, because of the 2 messages which has come out. That is, one is bacteria drug resistance. You immediately start giving antibiotics. And this is a typical South Asia or Southeast Asia issue, that doctors start giving antibiotics. And with that, gene mutation and then counter prophylactics and all that we discussed. And it's becoming a huge challenge because immunity is going.
What's your question?
The question is, what are we doing about it? Because we are talking about this problem. And then somebody said that in this whole issue, the vision for this is not there. And it makes us look very depressive and very negative on this. So you have all the specialists, we can hear from them.
So, different countries have different approach for this. There's many different things that are being tried all at the same time. So I mentioned phage therapy. That's an alternative thing that different countries are trying as well, where that's with extreme cases. But more importantly, I was just at a symposium on this last week. The main thing that was mentioned is vaccine preventable diseases, to really ramp that up, because that's actually the quickest way to reduce the use of antibiotics. And then if you reduce the use of antibiotics, the bacteria that are resistant to them drop immediately. So it is directly correlated with the use. So it's not, you said it was a bit depressing. Actually, why I think it's not so depressing is that actually if you stop using the antibiotics, the resistance will disappear, and the old antibiotics that didn't used to work will be effective again, right? So there's definitely things we can do. I'm just mentioning the vaccines here because it's one of the main things, but there's many different things like better diagnosis, use of more rapid tests like COVID. COVID was a huge opportunity. We developed so many technologies, not only rapid vaccine development, but also rapid detection tests. The little test with antigen that you do, these can be applied to all many other diseases. And if those are deployed more widely, then the doctors will more accurately diagnose you, and then you won't be treated with antibiotics when you don't need some. So that reduces the usage. But there's also with the whole agriculture sector, we're talking about One Health, right? It's very important that there's some control of how much antibiotics are used in agriculture, right? Not feeding them to animals so just they grow bigger, right? So that's practices has been banned in some countries, but not others, right? So this is definitely something the government can work on, working with agricultural sector to try to legislate it, you know? So there's many different things we can try. We're nowhere near the end of what we can try. So I think there's a lot that can be done, yeah.
Well, if I may come in.
Professor Neelratan, if I may add to that, I think just what you answered, that it's a problem, definitely. But as I mentioned, reducing your infection rate is the first point of contact. So sanitation and hygiene. But it's going to be difficult because we are getting warmer. The world, because of environmental problems, we are getting warmer every day. The warming effect, hotter every day. Population is increasing. There'll be overcrowding as days go on. So there'll be, density of population will increase. The world is getting warmer. For all that, infections are going to be more difficult to control. These are two issues which will make infection, more rampant. So I think decreasing infection is the most important thing. We have, because you can develop vaccine, you can develop new antibiotics. Now grade 4 antibiotics have come. So grade 5, grade 6, we can go anywhere. But I think the crush of the problem is controlling of infection, sanitation, hygiene. I think you have to touch upon some of people's awareness. I think blogging and awareness, what you were saying, are the main things that you have to do. You have to stop infection somehow.
Dr. Chakravarti, if I may come in on that. So, Professor Neelratan, I think public health experts don't like to talk about these two issues. But I do agree with you that it is a depressing topic because we know the answers, we know how to fix it, and we are not fixing it. So it means there's a lack of intent. And the two issues which public health experts avoid the world over, these two words are corruption and misgovernance. If you look at the UN country reports of a variety of agencies which are present in whichever country you are in, you will see that the UN reports have completely skipped the use of the word corruption or misgovernance. When it comes to things like antimicrobial resistance, that is where corruption and governance are critical to be addressed. So that is part of that whole issue. And countries, they have the regulation in place. Perfect laws, perfect regulation. But because of misgovernance or corruption, that is not being implemented. So the elephant in the room in any public health discussion has to be corruption and misgovernance, but it is not a convenient topic.
Thank you very much. I think I would like to I think we've already crossed our time limit. We had a wonderful panel, and I think each one spoke on a different issue. I think we had a very varied, different types of discussion which was needed. I thank each of my panel members, all well-known experts in their own areas and different areas. Thank you very much. It was a pleasure. Thank you very much to the audience, and thank you very much to Sulabh for giving us, and to WHO for giving us this opportunity for this unique session that we had this morning. Thank you.
Thank you so much, ma'am. Indeed, it was a unique session. So let's hear it for the esteemed panelists. May I please request you for a group photograph? Yeah, so you may kindly just take a step further, and we are going to capture this moment into our cameras. And for the felicitation of these eminent panelists, I would like to invite on the stage the president of Sulabh International Social Service Organization, Shri Kumar Dalip, and the founder of World Toilet Organization, Mr. Jack Sim. Please put your hands together for both of them as I invite both of them on stage for the felicitation. And we can have you in the group photograph as well. So I would like to request you, please add on to this beautiful galaxy and let our cameras capture this moment. Maybe please have the mementos on the stage. Now we are starting with this felicitation. So firstly, we are starting we have got the dignitaries and they are honoring our panelists with this wonderful memento. Let's have a round of applause, my dear friends. This is a mark of gratitude from our side to you, and we are presenting some remembrance to you so that when you go back home, you would always be remembering your esteemed presence on the dais for this World Toilet Summit 2025. We are highly thankful for your inspiring words and thought-provoking ideas, and I must say that these ideas are turning into action soon, and with the commitment, it is gonna change the way people think about sanitation, the comprehensive theme of World Toilet Summit 2025. Thank you so much, ma'am. Thanks a lot. With this, I thank all the eminent panelists on the dais, and I request you to kindly take your seat in the front because now we are ahead to our next session. So let's hear it for all the dignitaries one more time, please. And now, my dear friends, it's the time for a special session 5. Let me tell you that it is a special session by Ministry of Housing and Urban Affairs, Government of India. So we are going to have a lot of interesting things to learn from this and to discuss about and to have a gravity of the subject. So the title of this session is The Dignity and Safety of Sanitation Workers, which is indeed crucial. From manhole to machine hole. So how this whole path, the whole journey is going to be covered, we are going to discuss it in this session. Let me please share with you that this particular session is also going to be live streamed. So we have got the panelists who are going to discuss about this dignity and safety of sanitation workers from manhole to machine hole, and this is a dedicated session that would be addressing the urgent need to transition from hazardous manual sanitation practices to safe mechanized solutions, because whenever there is a challenge, there is always a solution. The only thing is that how we look at it. And once we get the solution, it gives a feeling of, winning over the challenges, and it makes us more excited about the subject. So this session explores policy frameworks, technological innovations, and social security models required to ensure sanitation workers that they are protected, respected, and empowered. Let me please share that the focus is on creating a roadmap for a just transition that upholds rights and improves livelihoods of these frontline environmental champions. So, I would like to now initiate this by inviting the dignitaries over here on the dais, because the dais is all decked up for our panelists. And with your round of applause, firstly for the context setting and the Ministry of Housing and Urban Affairs approach to know about that, I would like to invite on the dais Dr. V.K. Chaurasia, Advisor in Charge, CPO, Ministry of Housing and Urban Affairs, Government of India. Please put your hands together for his welcome. Please join me in welcoming on the dais Mr. Swapnil Desai, Deputy Engineer, Government of Maharashtra, Deputy Engineer, Navi Mumbai Municipal Corporation, Government of Maharashtra. So please put your hands together as I invite Mr. Swapnil Desai on the dais. And he is going to speak about the efficiency in operations through contracts and manpower management in Navi Mumbai. So this session is going to be really interesting. So nextly, please join me in welcoming on the stage Mr. Bilas Behera. He is EIC Odisha Water Supply Sewerage Board, Government of Odisha. Please put your hands together for his welcome. And he'll be detailing on the institutionalizing of capability building and welfare, Bhubaneswar. Please put your hands together for him. And also we are going to have the detail on achieving Safai Mitra Suraksha end-to-end implementation from, so for that I would like to invite Shri E. Kumar, Assistant Vice President, Andhra Pradesh, Urban Infrastructure and Asset Management Limited, Government of Andhra Pradesh. So let's have a round of applause for all the dignitaries who are here on the dais with us now. And since this is a really, really crucial and a special session from the ministry itself, so now I would like to invite them one by one. So firstly, starting with the context setting and Mahua's approach, Dr. V.K. Chaurasia. Please put your hands together for him.
Very good morning to each one of you, and I really thank ma'am the way she has introduced the topic and importance of it. So you may be really excited that what all in this important area, Ministry of Housing and Urban Affairs and states and ULB together they are doing. Here one thing I would like to mention that this subject, manhole to machine hole, has been very, let us say, close to close agenda or important agenda in the ministry, because a lot of development you might have seen after launch of Swachh Bharat mission has taken place, and in last 10 years you might have seen that because of this importance and impetus, the SDG goal we have been able to achieve 11 years before the target. You might have also observed that last 3 days in first session, Honorable Minister was present there in inaugural session. Yesterday, our Secretary and Joint Secretary both were present. And in this third day also, the brain behind all technical matters, Central Public Health and Environmental Engineering Organization, CPHEO. I am technical head of CPHEO. So all together are the way participating and trying to take it to people. To win this battle is very, very important, and definitely it will be appreciated all along. One point definitely I would like to mention here, that the way India has progressed, it has reached to Mars, it has also reached to Moon, and a lot of developments is being taken place. With such a big capability and capacity, you will be able to see that still some unfortunate deaths are happening while cleaning up sewers and septic tanks. So this is totally unacceptable, and to address that, Government of India together with state and ULBs and our partners, Sulabh, HUL and many other players, they have joined hand that we will achieve the target of 0 deaths in cleaning of hazardous cleaning or cleaning of sewers and septic tank. And that's why this topic is that manhole to machine hole, means create a situation where nobody will enter to clean this sewer and septic tank. It will be done through mechanization. This is target we are taking, and in this direction only we are working, so that we can win this battle, and all our people who are working and whatever these sanitary conditions to be addressed, they are able to manage well. So I would like to take you through one brief presentation what we have prepared, that what Ministry of Housing and Urban Development doing, and its contents. Yeah, here one thing is important. If you see the statistics, so urban population is something around 420 million. I am trying to show the magnitude, that what is the level of magnitude that we are dealing with. And almost in urban area compared to rural, what was presented yesterday, a lot of people and houses, they are having their own toilets, but wherever in slums and other places there has been any shortfall, those has been already constructed in form of IHHL, CTPT, and entire support has been provided. So this led to open defecation of the urban area and even in the country itself. But the challenge that arises, that how to keep it clean and functional and efficiently discharged, so that the purpose of achieving safely managed sanitation is fully achieved. So this was one challenge. And this is the magnitude where we have to clean septic tank and sewers. Another thing I would like to here bring the thing I mentioned, that in several cases this situation is prevailing, still prevailing. Many places we have funded a lot, you will see we have made effort that mechanization is happen, but somewhere because of various factors that also we will mention, still these things is happening in unorganized manner. Somehow I think we are not able to reach out to each and every household in such a convenient manner, like they are able to reach to, let us say, Zomato, Swiggy and other. That level of approach, if it is available, I think people will not go to informal sector and such type of problem will not come. So one statistics we have analyzed, I would like to bring before you, that in last 5 years, this 370 deaths had taken place, and if you see in this case, out of that, major deaths are more than 65% in septic tanks. The now situation comes that in septic tank, why such type of deaths are happening? So the one aspect is very, very important, that everywhere mechanization reaching this vehicle and other has been a challenge. Second challenge has been that in many places the septic tank has not been constructed to BIS or CPHO standards. Sometimes it is as good as a pura room size, and people also think that why to clean it, it will be percolating and we need not to open, take pain. But at some point of time when that situation comes, then this informal sector comes in picture and such type of challenges arise. So if you see that the death and other things that has happened, similarly to eradicate it, eliminate it, Government of India has taken very seriously, and together with Ministry of Social Justice, we have set this PEMSRA, Provision of Employment and Manual Scavenger and Rehabilitation Act. Under this, stringent provisions are there. If anybody unauthorizedly, they are engaging some person to clean toilet and septic tank, for first instance 2-year jail provision is there, even 2 lakh fine is there, and consequently if they are doing 5 years jail and other provisions are there. But in spite of this, is something is happening, it means really that we have to make more efforts to reach to people, and our mechanization has to be very easily available. These two things very clearly visible from this. Then as I mentioned, what are the hazards that is causing? It is lack of formalization of the sector, and then inaccessible area that I mentioned. Then the death is basically because of toxic gases, and even we have brought out many advisory and guidelines that in unavoidable circumstances, even if it is required to enter, there is proper protective gear and precautions through SOP, standard operating procedure, for cleaning up sewer and septic tank. But in spite of that also, I think it is lack of information, and where this entire gathering from different, in form of different stakeholders, their contribution become very, very important, that how to reach out to people, how to identify what are the small problems where such type of things are happening, bring to our notice, bring to state government notice, so that we can effectively address together. So less of awareness is one thing, and then poor this safety enforcement, that is another thing. Apart from that, the key, after this problem, the key initiative that has been taken by Ministry of Housing is Safai Mitra Suraksha Challenge. Initially, we did it for 246 towns and cities to understand that what is level of mechanization, and subsequently it is rolled out to all cities, even in Swachh Sarvekshan also, and various other ways we are trying to reach out that more and more mechanization takes place, and such type of hazardous entry can be altogether prevented. Another this very important thing is that how to, this is from social angle. Namaste scheme has been brought out by Ministry of Social Justice, and we are implementing together. Here they are dealing with social aspect, that how these people should be rehabilitated, how they can be empowered, how they can be educated, how they can be given entrepreneurship, or let us say some micro-entrepreneur sort of things, so that they are not enter in that unsafe manner, and they also their income and lifestyle goes, and it is open and take as a industry sort of things. Apart from that, the gravity of the problem and importance given by ministry, you can see that in budget scheme, budget speech 2023-24, it was placed and funds were also placed that entire mechanization of dislodging services and cleaning will be done. So this is some timeline that over from 2018 onwards, even before that also we have been doing, but some of the important things that we have brought, we are bringing out that includes Safai Mitra Suraksha Challenge, then mechanization, Swachh Sarvekshan, and also ERSU we have bring out, and Swachh Bharat mission itself is that one thing that is addressing all these things. One last you may be seeing that exploring R&D through CMRI. So Central Mechanical Research Institute, we have impaneled them and they are our technical partner. So whatever the vehicle requirement is there, they are doing R&D to even develop very, very small mechanized plants and all other equipment, machinery, sensors and testing. They are all working in that, and these things we are taking to industry partners also, and they are taking to the field. So that sort of effort ministry is doing. So here we will say that to achieve that four prongs strategy we have taken. One is institutional strengthening, second professionalization, and then welfare and also mechanization. These four aspects are there where we are working. So these are some of the institutional interventions. This RSA and ERSU that has been set up, and you can see that around 3,500 towns they have already done. It is a administrative mechanism that in unauthorized manner nobody should enter in septic tank, soak pit, and also facility available through call center. If anybody has any requirement, they can reach out, and that is already available here. So 24/7 line, and this standards are also there. That is also very important. CPHU has also brought out many advisory to guide and BIS standards on how to construct, operate, maintain. These things are also available. So on those fronts, whatever the gaps are there, we are trying to fill up and even strengthen it. Then professionalization of this is very important. We are bringing all these cleaning services on Upyog portal. There is one portal under National Urban Digital Mission. There this dislodging has also been put there, and the tracking of the vehicle where they are disposing and even dislodging services all are built there. Apart from that, empowering that private through, let us say, EOI, and also enabling standardized services across the country, that also we are supporting. And apart from that, we have brought out standard contracts also that will be contract with private sanitation operators and other things also for engaging private. So this aspect is also covered, and 100% in towards mechanization. We are trying that these things are altogether avoided, or wherever it is done in a professional manner, like through mechanization. So third one is this mechanization intervention. I would like to mention that a lot of funding support you may see we are providing, and the number of vehicles has been hugely augmented. Apart from that, private sector also through micro entrepreneurship, they are entering and helping that. Individual cities are impaneling them also. Business contacts are also there. The next 3 sessions, you will be learning some of the best practices that is going, that not only cover how to do end-to-end mechanization, how to do capacity building, and how to do efficiency in the system through private operators. So, and CMRI I already mentioned. So these are 1 or 2 examples I want to show which are the inaccessible type of area, and there the development that we are taking to the market is this through our manufacturers, our research institutions. Apart from that, some of the, as I mentioned, the septic tanks are not of 1.52 cubic meter, which can be dislodged. Some of them are very, very old, and situation is like that. It is already hardened, and sometimes suction, whatever machines are there, they are not effective. So to remove that, to overcome that, different type of these jetting machines with cutting nozzles and other things also we are bringing, so that it can be altogether avoided. So the fourth one is initiative, as I mentioned, Safai Mitra Suraksha Shivir. Here from welfare angle, we are providing health checkup facility also for each and every worker that is working in this area. And apart from that, those who are dependent and they are benefited, you can see the number. Under Namaste scheme also around 90,000 such people, they have been identified and they have been rehabilitated, including providing financial support. And they are providing now loan up to 50% also if any Safai Karmi want to become entrepreneur, want to purchase some machine. And even we are also supporting that if you purchase, you will be provided job also in the municipality, in touch with municipality. So those things are there. This Ayushman cards and PP kit distribution, everything has taken place. So these are some of the way forward, promoting affordable and scalability solution, then design operation and safety compliance, as I mentioned, and supply chain readiness through GEM and other, so that equipment can be readily in minimum time they can be procured. So this was the things. Then based on some of the front runner cities, you can see these are the things they are doing. Some 3 cities will be presenting, other you can see contracting model, 1 city operator, then Garima matter that will come in Bhubaneswar, dedicated web portal, periodic health checkup, increased life insurance, and then PSS. So these all things you will be seeing that these cities had been adopted in various. And if you see the Swachh Sarvekshan results, what they have done, the now marking is coming very close. It means many of them are having very full level of mechanization, and things are increasing day by day. So this is all from my side. Thank you.
Thank you so much, sir. And now I would like to invite Mr. Swapnil Desai, Deputy Engineer, Navi Mumbai Municipal Corporation, Government of Maharashtra, for his address. Please put your hands together for him.
So, good afternoon, everyone, respected dignitaries, guests, and my friends. I'm Swapnil Desai from Navi Mumbai Municipal Corporation. First of all, I would like to thank the organizing committee, WTO, and organizing team for giving an opportunity to present a case study of Navi Mumbai. So, Navi Mumbai is a twin city of Mumbai, and it is conceptualized in 1967 to decongest the Mumbai city. In 1970, City Industrial and Development Corporation was incorporated to plan, to develop, and to maintain the township of Navi Mumbai. And Navi Mumbai is formed in 1992, was established by joining the 8 administrative ward and nearby 29 villages from Gram Panchayat to Municipal Corporation. By increasing the industrial and commercial development in the city, there is a rapid growth of population, and NMC adopted a polycentric pattern of planning and development for the Navi Mumbai. So, due to affordable housing in NMMC area, there is a decadal growth of population, which is around 60% from 2001 to 2011. Now, and Navi Mumbai has a 18 million plus population, having a robust water supply and sanitation structure system, a well-planned satellite city, a self-sufficient, clean, green, and sustainable town, progressive in delivering modern civic services. So, obviously, it has around 109 square kilometers of area. Most of the land is having cover of 34% of mangroves, and residential and industrial around 23%. So, Navi Mumbai is the only city in the state to enter the Super Swachhata League in Swachh Sarvekshan 2024. It is the only city in Maharashtra to achieve the garbage free city 7-star certification. Also, the Water Plus certification, the first city in Maharashtra. A city has plenty of gardens, around 200 plus, and having an environmental friendly solid waste processing project that processes 100% of waste scientifically. We have a water-rich city with our own water reservoir that supplies around 450 MLD of water to the entire city. So, it's a planned urban powerhouses. We have 99% of sewage network and only a 42 number of septic tanks in the city, having a 7 number of sewage treatment plant based on a state-of-art technology, followed by the tertiary treatment plant with a capacity of around 52 MLD. So in the circular economy approach, around 30% of sewage treated is reused for non-potable purposes like industrial, municipal gardens, cleaning of public toilets. So in the contents of manhole to machine hole, so we have increase the operation efficiency through our comprehensive performance contract. This performance contract is a two-tier system. As we see, the entire user water management system consists of generation of raw sewage, then convenience, then pumping station, then treatment for raw sewage, that is for sewage terminal plant, and to recycle and reuse, we implement the tertiary treatment plant. So there are the entire value chain of total urban sanitation. We adopted two-tier comprehensive contract management system. From the generation to the pumping station, there is a one comprehensive contract. We have 8 administrative ward where comprehensive contract are adopted. And second tier system is for STPs and TTPs. So from the manhole to machine hole movement, we emphasize on mechanization since inception of Navi Mumbai. Firstly, we introduced performance-based comprehensive private contracts, which includes the mechanization of mechanized cleaning of sewer line septic tank for the entire city. And in the year of 2000, we adopted the policy to fully utilize the mechanized equipment as per the CPHO norm before the management scavenging had come into picture. And in the year of 2019, we established Emergency Sanitation Response Unit, that is ERSU, and RSA, as per the guidelines of Sapai Mata Sureksha Challenge and MOA. We have a dedicated helpline number for complaint related to the sewer line and septic tank. And under the Sapai Mata Sureksha Challenge, Government of India, Navi Mumbai ranks second in the country. We have around 290 Safai Karmacharis, sanitation worker. We have all the Namaste scheme has profiling done. So no manual scavenging is allowed throughout the city. And there is no single casualty since inception of NMMC. So this is the robust installation mechanism for monitoring of the entire cleaning of sewer line and septic tank. So we have a dedicated engineering staff medical officer and the private comprehensive contractor who is responsible to clean and to clean the sewer line through mechanized way. So there is a dedicated telephone operator, dedicated supervisor for each ward, and dedicated team that is authorized entrance, 790 professional, top manager, and the supply master. So this is a dedicated team which are responsible for all the mechanized cleaning of the sewer line and septic tank. For that, we had a contract, we had a provision for the eligibility of contractors. They must have all required machinery. They must have trained human resources with appropriate experience of operation and maintenance of a sewer system. There's a provision for incentives and penalties also in our contract. So this is one of the SR we are set up in our headquarters to resolve the complaint raised by the citizen. We have a dedicated grievances system, inbuilt automatic escalation matrix if the complaints cause the SLA in the system. We have a dedicated helpline for 14420 number for complaint related to the sewer line and septic tank. So this is the machinery is available within the abilities. As per the CPH now, we have a surplus machineries. There are the PPE systems, septic gears are there, other machinery equipments are there. So these are the different machines which are used for different operations, like section and jetting machine, which are useful for carrying out this section and jetting of machine hole. There are the dedicated sewer inspection cameras to identify where is the location of, which identify the exact location of the blockages. There are desludging vehicles which are useful for desludging of septic tank, and hydrovac jetting machines. So these are the fleets of Navi Mumbai PPE kits. So in order to ensure the occupational safety and operational efficiency, our contract has a provision for a preventive, regular, and breakdown maintenance. We have identified the hotspot for sewer blockages, and to solve the blockage through effective measures, we have a 24/7 complaint resolution. Digital monitoring can be happen. We have a dedicated Daksh app for sewer line complaint. So bi-monthly review meetings are there. Annual third-party energy audits are there through the certified energy auditor from Bureau of Energy Efficiency, Government of India. So end-to-end ownership of the contractor for the operation through SOP. So this leading to the automation. So we have a dedicated, comprehensive private contractor and the workforce for the entire user water management system, which ensure and manage through the long-term performance contract. So in the contract, there are the provision for KPIs, key performance indicators, specifically while speaking in the generation and convenience system, which consists of the entire distribution network of sewer line. So there's a detection of improper disposal of sewage, dedicated grievances cell, and Daksh app for customer complaints. And there's a SOPs for mechanized repair maintenance of machine hole through preventive and regular maintenance. Again, as I said, Navi Mumbai is having a 99% of sewage underground network. We have only a 42 number of septic tank, and for that, we implement the level transmitter mechanism to monitor the exact condition and exact level of that tank, and depending upon that, the alarms is generated to the respective desludging operator, and desludging operation has to be carried out, and it is to be disposed at the near STP. So these are the KPIs in the contract in the pumping station, where desilting has to be carried out with the help of mechanized machineries, removing of floating matters has to be carried out with the help of mechanical and manual screens. So there are dedicated SOPs for daily operations, preventive maintenance, breakdown maintenance of electromechanical equipment within the pump houses, and the energy efficiency measure, and the energy audit for the pumping station. For the civil infrastructure, we have a provision in the contract to monitor and to repair the entire sewage distribution network, which includes machine hole, then scrapper, and a dedicated operator will be there, skilled, semi-skilled or unskilled, with their PPE kit with the biometric attendance report. So all these operations are monitored daily or monthly. We have a dedicated application app for entire system. So these are the KPIs for STPs and TTPs to maintain the quality parameter as per the NGP norms and the operation maintenance practices. So to ensure the effective services and to prioritize the dignity and welfare of the Sapai Mitra, all our Sapai Mitra are covered through the quarterly health checkup. We have a health insurance facility of the state and central government. Then we provide the free medicine for all our Sapai Mitra, and we made a dedicated cell for it and at our hospitals for all the Sapai Mitras. We arrange a yoga camp for Sapai Mitras. So as Sir said, Navi Mumbai is one of the ULBs who is organized first ever loan mela for the Sapai Mitra. It is a capital subsidy for the procurement of the sanitary related vehicles, and 2 vehicles are provided to the Sapai Mitra, having a subsidy of around 25 lakhs at low disbursement to the Sapai Mitra. Again, for the kids, Navi Mumbai has provided around 7.1 crore of scholarship to the children. We have a dedicated resting room, provision of the PPE kit, then the recreation activities around the festivals. We have provided the funds and the Diwali bonus to the Sapai Mitra. Again, the Sapai Mitra, the access to the maternity scheme for the staff and the scholarship of the children. So monthly performance awards are also given on the NMMC. So we have arranged the capacity building program also and the IAC activity through wall painting, street dramas, public transport, awareness through schools and residential complex, through mascots, and the informal cities, and the video on the social media platform. So these are the welfare scheme we are provided to the Sapai Mitra. And under the Namaste scheme, all the Namaste IDs are generated from all Sapai Mitras. So this is the Swachhata Vahan purchased through the loan Mela, where Sapai Mitra get this vehicle, and it is actually it's the entrepreneur. We provide the salary to the Sapai Mitras. So for capacity building and welfare measures, we have arranged a training camp for the safety and mechanized cleaning, monthly awards, recognition and facility for the Sapai Mitra on important days like Gandhi Jayanti, Independence Days. So every 3 months there is a health camp, eye checkup camp, and scholarship to the children. So this is the yoga shibir for all the Sapai Mitras. These are the felicitation for the best award for the Sapai Mitra and the capacity building program. So this is a specific training program arranged from the expert. So this is a multi-platform citizen engagement awareness through wall media, through public transport, through mascot. And we are social being, we have been considered for the Sapai Mitra. So these are the safety gadgets we are provided for the Sapai Mitras. So into way forward, we are just shift from the mechanized to the robotization. So the trial is in progress. We are focusing on septic tank free city and encouraging the partnership for strengthening the circular economy. Also, we are encouraging provision of government scheme, including housing for the Sapai Mitra. So, thank you very much. These are some awards.
Thank you so much, sir. And now I would like to invite Shri Bilas Behera, EIC, Odisha Water Supply Sewerage Board, Government of Odisha. So please put your hands together for his welcome. Sir.
Good morning to all. Respected dignitaries on the dais, all participants here. I will extend my sincere thanks to the organizer giving me opportunity to be here in this program with you. This topic, manhole to machine hole, is very, very sensitive today. Why? The sanitation work has been taken care of by a specific group in the society in a very unorganized manner, in a very without any accountability. I will say this movement from manhole to machine hole is a must today. It is not an option. It is not a choice. Why? We are actually binding by these constitutional provisions of Article 24, 21, and 42, whereby we are the state and the center has to ensure equality and right to life and working condition to human. And Supreme Court has come up with several landmark judgments over the years on prohibition of manual scavenging and treating it as unconstitutional. Again, prohibition of employment and manual scavenging and their Rehabilitation Act of 2013, the provisions, we are binding to that. Most thing is why again it is a demand driven. Why? We are in a phase of very rapid urbanization. And Bikasit Bharat and Bikasit Odisha, if you will say, we have mandate to progress our urbanization from 31% to 53% as a national average, and in the state context, I will say it is from 17% to over 60%. We can see any development of any urbanization to go, the urbanization and sanitation go side by side. And the future demand for this sanitation, if we will not move to man to machine, so it is very, very difficult, very, very challenging to manage the situation in an effective manner. So this is the context: transition from hazardous manual cleaning, mechanized operations, ensuring safety, dignity and welfare of the sanitation workers, aligning with the national, state level sanitation reforms. This is the roadmap for how mechanization, 100% adoption of mechanization, sewerage, drainage cleaning, GIS waste tracking and work order digitization, fleet of motor equipments, all equipments, and incident-free operation through strict SOP, all those things. And to ensure this, to address this, the state and the center has come up with these programs: Safai Mitra Suraksha Yojana and Namaste scheme. And in my state context, I will say this is Garima scheme. Odisha has done many things by implementing Garima, and I will just covering all those things. This is all about circularity of Garima. The core sanitation work regulated to ensure safety, dignity with accountability. No sanitation workers is left behind to ensuring equality to all. Core sanitation workers are recognized as skilled professionals, ensuring universal access to health care and social security, fair wages with risk hazardous allowances. This is 15% allowances over and above their daily wages. This is about a scheme. What is covering? The open drain cleaning personnel, 1M of STP, FSTPs, storage cleaning network maintenance, 1M of CTPTs, and dislodging of individual households, all are covering under Garima. And this is the journey of Garima. In 2020, it is started by Honorable CM Odisha, and 21st we have a pilot study for 6 cities. And incidentally, in April 21, also 2 deaths have occurred, and those are compensated properly. And next May 21, then IRSU and guideline HUD department started implementing. July 21, recognition of CSW skilled and high skilled. It is a state recognition. And July 21, in the hands-on training started. Then April 22, then we scale up to 109. Now it is 115. All 115 ULVs have been covered. Then gazette notification for disability allowances. April 22 again, Garima camps conducted campaign mode, and procurement of distribution of PP kits made, and procurement of safety kits. All those are made, and those are identified persons under these sanitation workers. They are extended the linkage facilities just like other rational card holders and BSKY card holders. Similar way, the benefits has been extended, and for their dignity, the construction of a Garima house was made. And this is under Namaste scheme. It is linked with that. Then figures added to this. So far, we have 9,373 CSWs are identified across the 115 ULBs. And there is wages have been increased by 40% for high skilled and skilled, and further the R&A allowance also 15% we have added to them. IRSU operational in all urban ULBs, 115 ULBs, elevation of experiences CSWs to Garima supervisors, further promote an elevation and financial incentives improvement. Extension of disability support to illness allowance to CSW, hours of working because they are hardcore workers. So it is not from usual for 80 hours, then it is reduced to 6 hours for them. Enrollment of CSW under health benefits, 35 Garima Grihas. It is the story of 2023. Now it is increased a lot. How we are guaranteeing it? It is this way it was guaranteeing. We have a toll-free number and all ERSU in 115 ULBs 116 ERSU are formed, RSA are formed, and 77 PSSO are empaneled, safety procurement fees are provided, model contract are made, public RSA is made, PR monitoring is made, training through our one self-developed institute, Odisha Water Academy. Now it is the Urban OUA, Odisha Urban Academy, and appropriate and appreciation also, and adequate PPE is provided. This is the 77 PSO engaged. They are model contract, and all those things are interlinked with them. This is how address the challenges, how it is addressed. Individuality is addressed by IT enabled survey and sanitation workers. Occupational hazards addressed by Garima Griha, access to PP, capacity building, reduced working hours, and financial insecurity is addressed by recognizing high skilled and skilled laborers, enhanced the minimum wages, and this is weak and percentage addressed by strengthening emergency response, sanitation workers, institutional training, and lack of social safety needs is addressed by linkage of existing entitlement disability allowances. And this is occupational safety. All these things has been provided, and with a Garima logo and a standard list of PPE as per CPHO guideline has been ensured. Standardized quality PPE and equipment, safety devices, safety enhancement with a through a organization WATCO has been formed, and they have been monitored and provided through them, and all those things has happened. And this is Garima Griha, how it is very for their dignity and for their, they will feel proud, they will be for equality and dignity. How, with these provisions, the PP washing room will be there, come dining area, drinking water, safe drinking water will be there, washroom will be there, rest area will be there, change room will be there, lock room, they will come and put their things in the lock room, and they will go and again come back, they will take it. All those things in a very, and that room is very with fan, AC, all those things in a very dignitary ways. Then Garima uniform with Garima logo and all those PP uniforms are being provided to all the workers and all the units. Capacity building initiatives, for their capacity building, we have been doing regular hands-on training on all machine operations training, partnership with recognized institutions, digital SOP for safety protocols, certification and skill upgradations. This is the skilling, how in our own institute, how we are skilling them, and we have skilled 789 stakeholders, 71 master trainers, 841 SCPs, 77 PSSOs, 800 ERSU members. Bhubaneswar systematic approach by strong institutional framework with BMC, and dedicated sanitation cell contributing continuous monitoring and conversation with the various welfare departments. This is workers' welfare and society by health insurance cover for sanitation workers, provision of PP, safety gear, periodic health checkup camps, welfare registration and identity system, financial inclusion, access to benefits. This is institutional structures. This is institutional capacity building, OUA, Odisha Urban Academy, BMC Sanitation Cell, Exclusive Cell, what is coordinating, monitoring and reporting, PP framework for skilled workers deployment, workers welfare committee for grievance redressal, and integration with the state SBM Swachh Bharat Mission Cell. Innovation and best practices, digital training modules for workers, real-time safety audit system, e-learning kiosk at sanitation hubs, adoption of best practices from national and global models. This is the OEO structure inside how we are giving training, impact training and scaling up all those things. This is all those things through OUA. Impact achieved, improved workers' safety and dignity, reduced manual intervention cases, skilled and empowered sanitation workforce, enhanced efficiency and reliability of the sanitation services. This is way forward, advanced mechanism of AI-based monitoring, continuous professional development frameworks, expansion of welfare coverage, strengthening of institutional capability. Thank you all.
Thank you so much, sir. And now it's the time for a very important discussion on achieving Safai Mitra Suraksha end-to-end implementation and how it is going on in Visakhapatnam. For that, we would like to invite Shri E. Kumar, Assistant Vice President, Andhra Pradesh Urban Infrastructure and Asset Management Limited, Government of Andhra Pradesh, to please come on the podium and share the same with us. Let's have a round of applause for him.
First of all, namaste to all. I extended my sincere thanks to Ministry of Urban Affairs and Home to giving the opportunity to highlight the Greater Visakhapatnam Municipal Corporation achievements, making the manual to machine wall to success by using the mechanized machineries and process the sewage cleaning and machine wall cleanings in the regular basis. GVMC is the national leading Visakhapatnam as a Safai Mitra Surakshik share. It will be immense practice that acknowledge the Safai Mitras. There is the 5,749, sorry. The GVMC is nationally leading the Safai Mitra Surakshik share. The GVMC Professional Sanitation Service Delivery. GVMC approach the integrate safety, welfare and empowerment ensure and mapping the roles and responsibility of the sanitary workers. There are the 5,739 workers in the GVMC across the GVMC area. The WOS reference the efforts to commitment to incorporate the having earned and city, the first rank, the nationally first rank in the manual cleaning in the machine wall mechanism by using the machines. By eliminating the manual scavengers and ensuring the safety and dignity of the sanitary workers. Their hard work and assumption of the spirit of the progress. The GVMC is providing the safety equipments, PPE kits, twice in a year to Safai Mitras to prevent the occupational health hazards. Focus on manual scavenging from the sewer lines and machine holes and septic tanks and promoting the complete mechanized sanitation throughout the city. Workers are receiving the PPE training, safety SOPs, emergency response number they are provided. Safai Mitra social welfare and social security. Comprehensive social security and welfare coverage to all the sanitary workers by the Namaste program and ESI and EFI, ESF, EPFF are provided. Enrollment of the septic tank cleaners around the city, they are mapped in the government portal and they are eligible to the Namaste scheme, ensuring access the government welfare benefits and health insurance coverage to the septic tank cleaners, private partners. Implementation the EPF, ESI benefit to the workers also. Ex-gratia support to 2 lakh for natural death and 5 lakh for the accidental death. And also funeral assistant 25,000 provided for regular workers, 15,000 for outsourcing workers. Special salary accounts through banks. Safai Mitra welfare. GVMC prioritized the comfort and dignity of workforce through the welfare and reorganization of the programs. Annual supply uniforms, footwears, and other equipments they are providing. 15 casual leaves granted as per the SOPs. During the emergencies such as floods, civil dress provided to deploy the other ULBs. Monthly retirement facilities. There are the facilities given by the Safai Mitra welfare scheme. Safai Mitra enterprises. Under the NSKFDC schemes, 25 sanitation vehicles has been procured by our sanitation worker with 50% subsidy. operated on a rental model wherein the GVMC pays rent to the workers to owner. They're promoting the workers into the owner system. They are providing the 25 sanitation vehicles. Monthly income 10,000 per person. Improve their procured vehicle. This initiative to promote the dignity of the labor to transform the workers into self-reliant service providers. Our effort is facilitate economic empowerment and long-term financial stability of the sanitary workers. GVMC is governing the mechanized cleaning of the sewer lines, machine holes, and septic tanks, and using the Bandicoot robotic machines and jetting machines. They're all this one. And upcoming projects, new projects, the GVMC is planning to providing the robotic machine and invented by the IIT Madras. They're incorporated in the upcoming projects. These are all the monitoring equipments, latest mechanized equipments they're using for the sewage and septic tank cleanings. The sewer rodding machines, they are latest technology. Thank you.
Thank you so much, sir. It was wonderful how you people have actually brought your ideas and visions in front of the people. We really thank you for that. And I request you, yes, sir, you want to say something? Yeah, please do come, sir. Or, yeah, you can use that mic.
Just I want to highlight 2-3 points. First presentation, in case of Navi Mumbai, you might have seen, they are advancing from mechanization to robotic intervention. That is really, it will do the work of humans. In case of Odisha, Bhubaneswar, you have seen how they have organized their man force and they are giving dignity so that each and every self-help group is working as an entrepreneur. And third, in case of Visakhapatnam, the very important thing they did and they showed a lesson is they are empowering sanitary worker to become a business entity or a micro entrepreneur. So these 3 very important messages are there. And you might have already seen that Sulabh for a long time, they have been taking this responsibility of empowering these people and also keeping all these social things at very forefront. But given the magnitude of problem in the country, I think it is time that each one of you should consider who are in this line, they can do business, huge opportunities are there, enter in this area as a business entrepreneur and also do social work service as Sulabh is doing. So I think these commitments will really take it to next level and Viksit Bharat that we are aspiring. Thank you very much.
Thank you so much, sir. And now with this, I request you to please take a step forward for a group photograph, because this is such a moment when the eminent dignitaries are over here all together on one platform, and we would like to capture that into our cameras. With this, I would like to request Shri Kumar Dilip, President Sulabh, and Shri Jack Sim, the founder of WTO, to please come on the stage for the felicitation. And also, please do join in for the group photograph as well. World Toilet Summit 2025, hosted by Sulabh International Social Service Organization in association with World Toilet Organization. And now we would like to present these mementos to our guests. So starting with Dr. V.K. Chaurasia, let's have a round of applause. And now we would like to present this memento to Mr. Swapnil Desai, Deputy Engineer, Navi Mumbai Municipal Corporation, Government of Maharashtra. And another memento from Mr. Bilas Behera, EIC, Odisha Water Supply Storage Board, Government of Odisha. And Mr. E. Kumar, Assistant Vice President, Andhra Pradesh Urban Infrastructure and Assets Management Limited, Government of Andhra Pradesh. Thank you so much, all of you, for joining us in this special session indeed from the Ministry of Housing and Urban Affairs, Government of India. Thanks a lot. So I would like to now invite all of you for the lunch, and I request you to kindly reassemble in this hall exactly at 2 o'clock, and then we'll be starting with our next session. The session will start at 2, so I'll request you कि आप उससे 10 मिनट पहले ही आ जाइएगा. That will be good enough. Exactly at 2 o'clock we'll be starting with the session. So after lunch, see you back in this auditorium. Thank you so much.
sky. A throne that's green, a change of pace. Ikolu's here to save.
That's all division.
Okay. Too much light.
Good afternoon, everyone. Good afternoon, ladies and gentlemen. I'm so happy to see you all back here post-lunch. And now we are here for our next session. And this is session 6. So I would like to have your attention, all of you. Please settle down. Dear children, please settle down. I request all of you to kindly settle down because now in a few minutes we'll be starting with our session 6. So please settle down, and the delegates and the children who are still outside, please come in and be seated. Delegates who are just entering inside the auditorium, kindly settle down. आप सभी से मेरा ये विनम्र निवेदन है, कृपा करके अपना अपना स्थान ले लीजिए. अब हम लोग इस सेशन को शुरू करने वाले हैं. All the delegates are requested to kindly settle down. We are now starting our session 6. All of you are requested to kindly take your respective seats. So once again, a very good afternoon to everyone. Shilpa Bhavna is here, back again on the stage, welcoming you to this session 6. And as we are here for this session 6, let me please share with you that this session is actually exploring a real good horizon, and this is about turning the means of implementation into action, financing partnerships and participation for WASH. So this is such a subject, I can say this is a hot boiling for the talk, and in this we have got this core concept as safe sanitation for all requires sustainable finance and deep community involvement. So the means of implementation for SDG 6 particularly targets 6A, international cooperation and funding for water, sanitation and hygiene, and 6B, local participation in WASH planning and management. So this entirely solution-focused session will showcase how public-private partnerships, जिनको हम PPPs model कहते हैं, PPPs, innovative financing and community participation can accelerate sanitation goals and unlock unrealized potential. So this session is going to be really special. And before I invite the eminent panelist over here, I would really like to acknowledge the presence of Dr. Meera, a distinguished 5-time Mother Teresa Award recipient who is renowned for her impactful work with women and children in sanitation and WASH sector. Let's have a round of applause for her. I would just like to acknowledge her presence over here. आप सभी की तालियों की गड़गड़ाहट के साथ हम इन्हें सम्मानित करेंगे. Thank you so much, ma'am. Thank you. So since Dr. Meera is here, I hope this session has got a real meaning because she is one who has dedicated her life into women and children sanitation and WASH sector. And now I would like to invite on the stage our panelists. Let me please share with you that this particular session is going to be in 2 parts. So I would like to invite the panelist of the part 1, and then the moderator of part 1 will automatically take care of the part 2 of the panelists. So firstly, please join me in welcoming on the stage the moderator of this first part of the session, Mr. Dominic O'Neill. Please put your hands together for him. So he is the Executive Director of the UN Sanitation and Hygiene Fund. With over 30 years of experience in global development, he has held senior roles in the UK government, African Development Bank, and WWF International. He is recognized for advancing innovative finance, gender equality, and multi-sectoral partnerships to strengthen sanitation, hygiene, and menstrual health worldwide. Please put your hands together for Mr. Dominic O'Neill. Welcome, sir. And now I would like to invite on stage Ms. Shivani Mehrotra. Please put your hands together for her. Shivani Mehrotra, she is the Divisional Head CSR at Apollo Tyres Limited and is a CSR and sustainability leader with 16 plus years of experience across health, livelihood, education and environment. She has empowered over 20,000 rural women through impactful initiatives and brings strong expertise in strategic planning, M&E, SROI, ESG, and data-driven program design. So we are indeed privileged to have Ms. Shivani Mehrotra. Welcome, ma'am, on the dais. And now please join me in welcoming on the stage Shri Suguru Sakata. Please welcome him with a round of claps. He is the Asia Regional Leader for Lixil Sato Division, driving market expansion across India, Bangladesh, Indonesia, and Philippines. Since joining Lixil in 2003, he has led domestic sales, exports, and new market development. His leadership advances safe, affordable sanitation solutions for underserved communities across Asia. Please put your hands together for Mr. Sakata. And now I would like to welcome on the stage the founder of Saraplast Private Limited. Please welcome Mr. Rajiv Kher on the stage. He's the founder of Saraplast Private Limited and the managing director at Asia Satellite Industries. A pioneer of India's sanitation impact sector since 1999, he has built the country's first large-scale portable sanitation and liquid waste management enterprise. That's remarkable. A recipient of global awards, including the GSG Entrepreneur of the Year and CNN IBN India Positive Award, he has contributed to national policy, Swachh Bharat initiatives, and women-centric sanitation solutions. Please put your hands together for Mr. Rajiv Kher. And now I would like to invite Mr. Jayant Bhagwan on the stage. Let's have a round of applause for his welcome. He is the Executive Manager for Water Use and Waste Management at the South African Water Research Commission. With decades of experience in water supply, wastewater, and sanitation, he focuses on next-generation sanitation technologies, reuse, innovation, and benchmarking. A founding member of the FSM Alliance, he chairs the IWA NSS Specialist Group and is a Senior Fellow of Visa and IWA. Please put your hands together for Mr. Jayant Bhagwan. And now I would like to hand over this mic to Mr. Dominic O'Neill, who is the moderator of this session. Please put your hands together for his welcome.
Thank you and good afternoon again. I get the lunchtime slot, which is great. President Sulabh, His Excellency President Jack Sim, I think he's here. Thanks to everybody. We have a very dynamic session with some great leaders who are going to bring in a very business-centric approach. I'd like to do a little exercise first, though. I may need Shivani's help. Can you please stand up if you think sanitation is important? Please stand up. We're getting there, Jack, we're getting there. Can you please raise your left hand if you think hand hygiene is important? Wow. Can you raise your right hand if you think menstrual health, keep your left hand up, if you think menstrual health management is important? And if you think we all need to do more, wiggle your fingers and your hands like that. Fantastic. Great. Give yourselves a round of applause. Now, nobody can be asleep after that. Oh, we have a dissenter here. So security is coming for you. Okay, look, I'm not going to say anything. I spoke yesterday. I'm very grateful. I'm actually standing in for a very dear friend of mine, Neil Dott from Aquafed, who was meant to moderate the session. He's promised me a free lunch for doing this, so I'm going to take no more time. I'm going to hand over to Shivani Malhotra, who I had the pleasure of talking to last night from Apollo Tyres. I learned a lot, not just about sanitation, but about tyres. And I'm sure she's going to inspire us. So thank you.
Good afternoon, everyone. I would request to play the AV which I have put in the presentation, and then I'll take you through the journey of Apollo. Can we go to the next slide? Please click on the video. There is a link on the video. It's mentioned on the slide at the right. On your right. Excuse me, can you please help me with? I need to just click on that video. No? On the, it's mentioned there, yeah. If you can click on that. Is it not working? It's okay. Need not to wait for the video. You guys are already seeing the video actually. It's working throughout the day for last 2 days. So I just wanted to start the keynote address with that how sanitation is important. It's not only the issue which is specifically to the women's sector, but it is for everybody, people with differently abled people or people with any kind of sector. Safe sanitation is a basic human right. When I was talking about the video and this specific slide, if you see, there are two pictures. It's one picture is before and one picture is after. The first picture where the woman is covered her towel, it's basically a woman is waiting throughout the day. She's waiting, the night should come. That is the time she will hide her face and then she will go and go for in the wee hours basically to attend the nature's call. And the second picture, which is about where she has opened her towel, it's about the journey wherein Apollo has intervened, how Apollo has helped her to get the sanitation, safe sanitation, and how she has liberated. Now in a daylight also she can come, and it's about the matter of dignity. So that's how I wanted to start my slide. Now I'm just coming directly to some core facts which we have already discussed and everybody is already aware about. There are nothing which is new to anyone. Just wanted to put up certain things that if we talk about industrialization gives a lot of good things. Obviously, when it talks about economic growth, it's talk about development. But there are certain challenges also which comes along with this industrialization and which is across the world, all the geographies, all the countries are facing. So if I talk about an Indian scenario, there are rapid growth is happening. Industrial areas are developing day by day. We are working in many of the SEZ. There is a migration happening from the rural to the urban area. But cities are not able to actually handle that pressure, and we are still lacking the infrastructure facilities in those areas. I'm specifically talking about the regions where we are operating, where we have our manufacturing locations. And we have actually seen that how the divide is happening between the socio-economic development alongside the public health need, how there is a divide because of those development which is happening. And at the last, obviously, the sanitation is the major issue which is happening across places because of the lack of the facilities which are there due to the pressure coming from the migration and from the other places. Sanitation, a global challenge when we are talking about, and the focus was that it is only on the SDG 6, but I would say it's not only the SDG 6 which we are targeting. Sanitation is a global issue and it is overlapping with various SDGs. It is impacting the education of the girl child because of the lack of proper sanitation in the schools. There is a dropout case. Because of the menstrual issues, they are unable to go to college, schools for the continuous education. Gender equality is another major problem because of the assault, molestation, going in the field in dark area. And when I'm talking about gender equality, it is not only related to the women. In fact, even the people who are with the disabilities, they also get different kind of assaults and the molestation issues when they are unable to access the safe sanitation practices which is not available. Water pollution, everybody is all aware about that, how clean drinking water and sanitation is so much interlinked. And definitely it is impacting the economy as well, because people, when you are unable to manage your own health and you are unable to manage the surroundings, it is impacting the economic development also of that particular region as well as the community at large. So when we are talking about, and in Apollo, whenever we are thinking, we always try to connect our program with the national agenda as well as with the development agenda. We try to support, we try to bridge the gap to come join hand with government so that we can create the larger impact in the society. in my second slide, when I was talking about the gray side of the industrialization, that how industrialization has impacted on the sanitation and the other issues which the globe is facing. But if I talk about the good side, definitely a lot has already happened and a lot needs to be done. In India, obviously, Swachh Bharat mission was the game changer. We were facing the issue of open defecation. India was declared open defecation free in 2019, but still at the ground level, there is a lot of gap. It is related to behavior change issues. There are toilets where people are not ready to use it because of the old practices. Even infrastructure is not well equipped with. So those are the places where there is a lot needs to be done. At Apollo, when we are talking about sanitation is one of our key area of intervention which we have identified. We are working in the 4 key thematic area, under which environment conservation is one of the key area, and solid waste management and sanitation is one of the key priority area which Apollo is working. We have created the sanitation facilities for the migrant community in and around our manufacturing locations. We call our sanitation management program SPERSH. SPERSH is basically, it talks, we have actually, you can read, I am not going for all this, the entire SPERSH abbreviation. Safe sanitation is one of the key indicator under the SPERSH initiative. And why Apollo is working in the, as a tire manufacturer, why we need to work for the sanitation. When I was having a discussion with Dominic and Neil, he asked me as a tire manufacturer why it is a need for you to get into this thing. So when we were discussing, I explained this thing to him that we work for our stakeholder. For Apollo, community is the major stakeholder, and we work in a manner wherein our main tagline is creating a positive impact in the lives of stakeholders. And how we do it, we actually create the holistic development of our community. We want that the community should be healthier because maximum of the labor force is coming from those particular area. So we need to create such facility which can actually support the business as well. So that's how the SPERSH program is. Under SPERSH, we are running 3 major initiatives. One is Clean My Village, which is a sanitation and waste, which is a dry waste management initiative and recycling. And the sanitation management initiative, here we are not only focusing on constructing of the toilets, we are actually creating the bathing facilities along with the toilets. Because if we talk about toilet is an issue, even open bathing is also an equally major challenge in the rural communities. So we partnered with government in the initial phase of Swachh Bharat, and we tried to do the match funding wherein government was constructing the toilets. They were giving some grants for constructing the toilet. We said we will be doing the match funding and we will be actually doing the toilets with the bathing facility, not only restricting ourselves only up to the toilet construction. And the third is, being a tire company, we also are conscious about the end life of tires. So therein, one of the initiative is where we are using the waste tires to actually make the playgrounds for the children. So under Swachh Bharat, under the Safe Sanitation Initiative, although the numbers are not very big because it's a very small program, it started very recently. But the thing is when we are reaching about the initiative, we are talking about, we actually get into the quality of the program. We ensure that it's not the only structure which is standing in the community. Because of the engagement, because of the behavior change communication exercises, we ensure that community is actually using the toilets, because that's more important. It should not only look like a model in the home, but it should be in a use. So over 46,000 people we have covered under this initiative through awareness, and over 6,000 people have been benefited directly with this program. And we do a dipstick of the toilet usage. That is the major USP of our program, how we actually ensure the quality, and we also monitor the impact of the program. And we can say that over 99% of the families are actually using the facilities across our regions wherever we have constructed the toilet. So that is itself is a bigger advantage of this program. And women have actually identified this program as a major support system for them. They feel that it is the safest place for them because they need not to now go for the open defecation. So this is what there from the Apollo Tyres about the sanitation management, what Apollo is doing for the sanitation space. Thank you so much.
Thank you. It's great to see large companies like Apollo. I understand you're a sponsor for the event as well. What Shivani didn't mention is that if you type in Sparsh online, you'll get a secret 20% off code. Is that right? No, I've just made that up. Okay. Now, we have another giant of the sanitation economy, Saito, which is under the umbrella of the Lixil Corporation. And so I'd like to welcome Mr. Suguru Sakata to come and talk to us about your work and what you're doing to increase the access to sanitation. Thank you.
Hello, everyone. Good afternoon. At first, thank you for warm welcome, and also President of the SLAB International, President of the World Toilet Organization. Thank you for giving us these opportunities. So Lixil is a Japanese company. So we established this company in 2011. So after 5 Japanese big companies merged together, and we started this journeys. So in 2013, our company got one request from the Bill Gates Foundation who want to improve the sanitation. So we fly to the Bangladesh. So today, maybe from like a private sectors, I don't say like a secret, but what I can share is what I'm talking to with my sales teams. Just only 2 things. One is how can we customer-centric approach, and so 2 things is first one is to understand the target. Second point is how to create a motivations to the peoples. So of course we as private sectors we have some like a business. In this case, what do you think? Who is target customers? Of course distributors, retailers, mason, artisans, communities, also like end users. So if I say for example 7 years old girls, do you think she can be our customers? Maybe you think just a little bit hard for 7 years old girls to think about sanitations. But if we can understand why she wants sanitations and what is like main reasons she want to buy, which is like motivations, still we can convert to the customers, and she can support next communities. So in 2017, when Jack came to our office, we discussed about one stories. In some Southeast Asia countries, we found one girl. So she's a 7 years girl, and every day she went to her friend's house. So someday her friend said, "Can I visit your home?" But she feel very bad because she cannot say yes. Because she understands she doesn't have a toilet in her home. So as I said, target customers. She has a good reasons to buy toilet. So we reach out to that girl, and then we ask what type of toilet she want to get it. So luxury toilet, like a shiny ceramic product, or water conservations. Maybe water conservation, maybe she couldn't think about it. But she just want one toilet at her home. So she talked to her dad and her mom. I want a toilet. because I want to bring my friends to my house. So, as I said, the motivation for her was, social standings. It's kind of, status. So yesterday I met with, Jack Sim, and he said that, let's, make a, really good business in, bottom of the pyramid segment. I really understand, that, we can make it. Because, this market will grow. So in Japan, every year we grow roughly 1 to 2%. But for India, 7%. Other countries, more than 5% growth. If, this multiplies, 1 decade later, it will be, more than 50% growth. This will be a good market for, sanitation players. So, from the, access, toilet, also toilet papers, toilet cleaners, also, transporters, like, dislodging service and transportation service, also, treatment. And then, we can reuse it. So, this market will grow soon. So that's why, now we want to prepare. So, our company is, happy to, talk with you, to collaborate, and let's make, better, futures for everyone through the sanitations. Thank you.
Okay, thank you. And now I'm going to hand straight over to Rajiv Kerr, an old friend of mine, and he's also from a very large sanitation corporate, and he's going to give us and share some of his experience. And Rajiv.
Thank you. Okay, I think this is nice. So I've been in the sanitation space for over 25 years, 27 years actually, and this is the third event that I'm attending for the World Toilet Summit. And there's so many faces that are familiar, I've known them for years. The community is quite small, and the reason for that is because apparently hasn't grown at the rate at which it should have been growing. So although there have been significant changes, and I think the World Toilet Organization with Jack at the helm of affairs has done incredible work over the years. But that's not enough, and we need more ambassadors like Jack. I think all the countries should have a Jack in them, and maybe that could be his new role to make more Jacks. But on a more serious note, I think so. My journey has been quite interesting, and I don't have really a presentation as such, and my role has evolved over a period of time. Being an entrepreneur, founding a few companies, growing them, scaling them, getting private equity, exiting, building new innovative products and services. And my recent current role is as the managing director of Satellite Industries, which is the world's largest portable sanitation economy company. From portable toilets to trucks to deodorizers, consumables, and several whole host of products. We have a small presentation, just 5 slides if you can. That's what we make. We make vacuum toilets, trailers, consumables, plastic toilets, and we have plants in the US, in Europe, and we're now focusing very, very critically in Asia, and that's really the next phase of development for Satellite. As you can see, that I do not want to go into the details of that, but that's a very high quality trailer that we've been manufacturing at our plant in Indiana, and similar ones will be made in Asia now. Manufactured here in India and also in Thailand, Singapore, and other parts of Asia. Founded in 1958, there are about 950 employees, 16 countries. Equipment provider, global leader in sanitation equipment. Just Satellite Industries has a revenue of approximately $500 million US and growing. The entire group is a lot more, but Industries is about 500 million. We do a lot of innovative work. We're doing smart toilets. We're working with automated access control and high quality restrooms for public and also for the portable toilet market. So Satellite has been a partner for various companies worldwide. I do not want to spend my time talking about satellite and about, I think the sanitation business is well known to all of us here. We're a part of the same community. I'd rather pass on the mic to Jay and then Dominic again to talk about the subject that we're discussing, which is more pertinent to the business models and creating scale for sanitation products and services, and to grow these businesses and make them profitable. I believe very strongly that there's a lot of revenue, a lot of money in sanitation, but you have to be patient, you have to be at it, and it is a fantastic business to be in. There's a big purpose behind it, so profit with a purpose is always a really great act towards your country, towards your city, and that's something which has been at the foundation of the ethics that I have based my journey on, and continue to do so in time to come. So thank you very much, and I'm really grateful to be here.
Thank you. I hope for the school group, the school pupils who attended, were you the same group that attended yesterday? You are, good. Well, it's good to have you back, but we talked about, whether you can make wealth out of waste, and you can see that here's a future career prospect for you to try and get a job in the private sector. Sanitation is a really important sector. It's a fun sector. But it is possible as well, both in the public and private sector, to have a career. So I hope you're watching carefully, making notes, and working out what you're going to study at university. On which note, another inspirational character who has probably been to a few World Toilet Summits before, I'll hand over straight to Jay Bhagwan. And you can talk at the podium or you can talk here. Yeah.
Thanks a lot. Coming to a Sulabh event is like a pilgrimage, so thank you to Sulabh. You get a lot of inspiration. It's my second one. I think I was there for the first one. I have a few slides if I can get that little toy. Just a disclaimer, I'm third generation Indian, but I'm South African, and so is my colleague Dr. Badruddin as well. So. Yeah, I live in South Africa, but I also use the sanitation facilities there. I just want to remind you all, and I think Ms. Mehrotra captured it and what was said. Sanitation is not an engineering solution. It's more than that. And I think many years ago, when we kind of conceptualized and founded the Toilet Board Coalition, with a lot of strategy, we created this future. I think we've forgotten about it, that there is a toilet economy out there, okay? And it's more than just infrastructure. Building infrastructure fails. And I can come back after 10 years and I'll tell you how the Swachh Bharat is failing. Because you have a whole lot of engineers that only think about concrete and doors, okay? And they don't think of the broader ecosystem around the circular sanitation pathways, around the smart sanitation pathway. But we keep hearing about behavior change. Dignity is more about aspiration, not just a toilet facility. And how we sell and market that aspiration was very, very key in the delivery of sanitation. And we forecasted that 10 or 15 years ago as a mechanism to reach that. Now, we heard a lot about the day around the toilet economy and the opportunity. If you want to be in the business, just to give you the statistics, globally we produce 3 billion kilograms, I won't use the word, of resources every day. If you haven't done your bit today, please deposit it because somebody wants to exploit it. But that's a lot of raw material, okay, a lot of raw resources, and it's a very big opportunity. And the good thing and the good news is that we'll run out of water, but we will never run out of feces, okay? So if you want to be in the business of sanitation, look at it that way. There's a huge opportunity. We call it the brown gold of the future. Don't buy gold jewelry, buy feces and store it. It'll grow. So we're transitioning in this model to what we call, we started with the fecal sludge management period. We went into the non-sewage sanitation period. And we're now transitioning to this water-efficient sanitation future. And the reason to it is that we've seen over the period as we analyze that municipal managed systems never survive. I mean, I come from a country where 80% sewage, only 40% of it works. Not to say we don't have it. I read sometimes the statistics in India, STP this way, FSTP that way. When you open the back page, everything's failing, okay? Because there is no business model to it. It's still very engineering. And this religion of citywide sanitation planning, CWIS or CMIS or whatever you call it, it's all about municipal managed, okay, a public-driven model. And it's failing us in the developing world. Where we should be transitioning is to what we conceptualize as the sanitation sensitive designing. It's linked to spatial issues. There's more density. We can't put in pipes. We can't plan for the kind of infrastructure of the 20th century that we have inherited. So we have to get smarter. And the smarter way is to start evolving to an industry-driven model. And I think it's what you're talking about. How do we unlock that potential of an industry-driven model? And we have to thank Dr. Pathak, because I think in his early days, he already created that disruption. We were just too naive to absorb it and put it to scale. But he was already starting to show the pathway that there is an industry in this brown business, okay? But politicians and officials, it's very hard for them to learn and listen. You need a crisis before anything happens. Now, in South Africa, we picked that learning from Dr. Pathak, and we set our pathway because we come from a very water-stressed country. Flushing is going to be a luxury for us very, very soon. We can't flush 9 liters, at a time, etc. So we set a future disruptive pathway called Sanity. Okay, it rings a bell, Sanity. It's called the Sanitation Transformation Initiative. And it was trying to build this industrial model that we could leapfrog this whole market and ecosystem for sanitation services. Not just looking at technology, looking at the industrial pathway. Do we have all the industries in place that can manufacture new products, new services, distribution, logistics, a whole lot of stuff. There's many, many factors in it. You had to fix the policy environment, the sanitation policy, the government policy, the industrial policy, the research and development policy, all of that needed to align to support that direction. And then you need technology standards and regulations because you're now servicing people in their house. So you needed to get a whole lot of these things in place so that it enables the environment. And then you need a lot of support in terms of R&D, in terms of demonstration, market creation, etc. And we forget that, like I said, sanitation is not all about engineers. We need a new cohort of specialists. You can't take a wastewater person and tell him do sanitation. He doesn't even know the characteristics of feces. That's the big problem. He's going to give you BOD, COD, TDS, etc. That's not what it's all about. And then as we evolve into this, the other key elements become changing behavior for seeing it as a service, not infrastructure delivery, but also organizing a variety of service models that are influenced by creative financing and financing products. Technology is not cheap. New technology is not cheap. I mean, you look at India and how it's evolved. When I was here many years ago, I owned a Hero bicycle, and that was hard to get. People today in the lower bracket of society have 2 or 3 motorbikes, and they're also trying to transition because you created an ecosystem of service model, financing, and a whole lot of behavior change. Now you can't even drive in the traffic in India. It's got to that point. So this quadrants, that play around creating this new market, it's about spatial planning, understanding spatial planning, its limitation. It's about going to decentralize, not to going to centralize. Using the opportunity of valorization, beneficiation, but while doing that, creating the sanitation business opportunity, getting more entrepreneurs in the system, growing them, so they become like the Uber of sanitation. Yesterday when I heard that Uber is launching sanitation, I thought it's going to be a toilet that you order in Lajpat Nagar now, and say, please, I need it, and they'll send you a toilet, and you have a clean toilet. It went the other way, but something for them to think about. And a whole lot of circular pathways we talked about, that seeing human waste as a resource. But behind it, we also have to re-engineer the toilet. And I think it's what Dominic says, that the reinvent the toilet, or re-engineering the toilet, is what we have to keep pushing as the boundary to find new solutions, that it becomes an appliance in the future. And that is possible. So, we have this thing that I showed you the first slide about how much feces is generated. We coined this term called the Sanicon. Rajiv is not there yet. He's $500 million business. But the unicorn in the IT industry are people that break the $1 billion bracket when they sell their software, etc. In this brown business, we're looking for the first Sanicon, the shit master that's going to go through and create a $1 billion business. It is possible if we change the environment, we change the way we do things, because in the end, it's not a technical problem as we think. It's a governance problem, and it's an institutional problem. And that is what blocks us from transitioning in this direction. So, like I said, there's a brown revolution coming. Be part of it, because somebody's going to drive a Ferrari, a brown one, very soon. Thank you.
Just to be clear, are you offering us a Ferrari, or where do we sign up?
A special model.
Great. We've got a few moments. I'd invite some questions from the panel. I've just got one, in particular for the colleagues from the private sector. If you were pitching to the government, any government, or India government, any government, what would you say are the advantages of partnering with the private sector? Because obviously people are worried, oh, you're going to come and make money, sanitation's a human right. What would you say to pitch to encourage people that the private sector can play an important role? In order, thanks.
Yeah. So I think without public-private partnership, there is, to begin with, profit is not a bad word. Because without profit, you cannot grow. I think profitability is key, it's core towards scale. So first of all, your business model has to be profitable. And when you go to the government or when you go to any kind of authority, I think to show them that this is going to grow and it's going to help people, and yes, if profit is one of the motives, then yes, it's the way to go. And the way to, I think, pitch to government is that the job of government, as Jay said, is basically governance is their job. But creating business models, scaling them, reaching out to people, bringing benefits to them is the job of the private sector. It's the job of the people. And I think if you have the capability of creating a finance model, creating a business model, and scaling it and taking it out to people, generating jobs, generating all the entire ecosystem of finance and commerce, I think it's the only way to grow, because everybody is incentivized, everybody is getting something out of it, and honestly, that is the only way to grow in the market.
Yeah, I can say, so without, any collaborations, we cannot achieve, big milestones. So, for example, like our company can, provide good innovations. So innovation can only do the, more like a private sectors. Of course, government can do some, but not like a perfect. So, both organizations, like a government has, some strengths and weakness. Also, the private sector has, a strengths and a weakness. So, to create good like strengths and synergies, then we can achieve the target. That's what we can propose.
Yeah. Thanks, Shivani. And then I've got a question for Jay on willingness to pay in communities. Just a heads up.
Yeah, for the partnership point of view, if I talk about, I think so corporate and government goes hand in hand. Government has a major systems in place. They are from the grassroots, as he said, from the governance till the implementation. There is a entire setup is there. And when we talk about corporate brings expertise, they brings the money, and with the collaboration, actually where you are reaching to the grassroots and you have to scale up the program, you have to create a wider impact. Partnership is the key, and that's how we can make the program more successful.
Great, thanks. Jay, for you the question, South Africa has done a lot to engage the communities who live in very vulnerable places, and there's a history of not paying for services. So how would you encourage the private sector partners to approach those communities? What would you do to build the community's confidence that this is a way forward?
So, you know, the thing is that we get trapped into trying to sell infrastructure. You know, that's the problem. I mean, you know, imagine if you use a clothes washing center as the aspiration so that the toilet is attached to it, and that's secondary. So people will want to pay for washing their clothes. And while they're there, they might just pay for using the toilet. So it's changing that behavior and creating that aspiration and the value proposition. It's like all of us. I mean, you know, you can buy a BMW, you can buy a Maruti. You know, marketing and behavior changes the way you react, and sweet financing deals make it attractive, so you choose what you want. Doesn't mean you cannot afford it. You know, it's an aspiration, and you make yourself available to have it. Now, like India, we a very strong public sector with a lot of fiscal strength, you know, in providing, but it's all engineering. It's not services. I mean, I can tell you we had thousands and millions of sanitation facilities keep rolling out because engineers want to make it invisible. They don't want to see it that poor people use it or etc. They tick the box and they say, we did our part of the job. Okay, but it keeps failing. People want dignified service. You know, toilet is just the means. The operation and maintenance, the servicing, the value add is what is very key in ensuring that sustainability. So we're trying to wean away from that model and use a lot of the subsidy mechanisms we have as an incentive to blend with the private sector models, etc., to drive the service model where we can go beyond a very basic toilet to an aspirational toilet with other facilities, etc., and servicing. I mean, somebody today we said, who washes their own toilet? I could come 10 years before that in India, no one washed their toilet. The thing is that now you have access to more sorts of chemicals and products and tools that you prefer to do it. It's quite easy, it's quite quick. Otherwise, you know, you had helping hands to do that. So you can shift the market. Poor people are much more faster to shift because they see greater value proposition. They see better convenience in the processes. And we're already starting to see with some of our programs where people are prepared to pay and buy the service, provided you bring the right service to them.
Great, thank you. We've got time for 2 questions. I'll save a third question if somebody from the school group puts a hand up. No pressure, but if you want to ask a question, we'll prioritize. So I'll take 2 questions on the condition these are questions, not statements. I'm inclined to start with the person whose phone rang. Who was that? No, okay, I won't pick on anybody. Does anybody have a question for the panelists? Please say what your question is and who is it to. Or is everything perfectly clear? Wow.
Only ask difficult ones.
Oh, we've got a statement. I'm holding out for a question first, but then later. Any questions for the panelists? Otherwise, a gentleman here. Anything from the school group? Where, somebody, I can't see it. Put your hand
Hello.
up.
Can I ask?
Please. Oh, yes,
Yeah.
sorry, over there. Thank you. Please go ahead.
Actually, I am from the disability sector, and I want to know what is being done for the accessibility of the toilets for persons with disabilities. And because I saw a few of the stalls outside, and in fact, I was interacting with them also. So if there is a person with disability who is using a wheelchair, so what kind of standards you are following, or if not, what can be done? Is it a question?
That's an excellent question
Thank
that I'm
you.
going to actually put to anybody who wants to answer it, starting with Rajiv.
I think that's been neglected for a very long period of time. You're absolutely correct. But I think over the years, if you've seen a lot of restrooms have started having ramps, and in fact, Andy runs a fantastic place in Thailand where he's got ramps at his toilets as well. So I think it's a trend that's picking up all over Asia. And as a company, Satellite has been providing wheelchair accessible toilets and also ADA compliant toilets. ADA is the American Disabilities Act. So two types of toilets. One is a wheelchair accessible where you can actually go and the entire wheelchair would turn inside. And the ADA as well, which is a much larger toilet. And we have brought these products to India, and we have been promoting them for a period of time. We are going to be more aggressive, and maybe with the help of people such as yourselves, and along with Sulabh, maybe we can actually foray into this and look at providing this to urban and rural India.
So I think I can share Japanese experiences. So around 1980s, every toilet was a squatting type of toilet. However, around the end of 1990s, government decided one regulation and policies. Every toilet need to set up two types of toilet, squattings and also stools, because a country aim to achieve universal access. So now everyone can use toilet. Then after 20 years, currently in the school, if we have 5 toilets, 4 toilets is stools and 1 is squatting. So of course a trend, but government push for everyone can start to use a toilet.
I'm just conscious of time. I think it was an excellent question. I think it's going to play into the next session. So for those who are presenting, I think there may be a follow-up question. But it's something we need to think about in every single design and every sanitation program. Will this drive gender equality, and will it drive access for disability? It's something we should constantly think about and have at front of mind. I'm sorry to the gentleman, we're out of time to make any, we might have time right at the end, but I'm very conscious of that. Thanks for your participation. I'm going to invite everybody apart from Shivani, so if we can have a round of applause, if you can return. Thank you very much. You'll come back on stage at the end, I think. No, Shivani, you stay. The gentleman will go, and I'm sure you'll be called up by the organizers. Thanks a lot. Don't go too far. And now, for the second part of the session, group photo now, okay. So if you bear with us, we're going to do a group photo of this section. I do what I'm told. So, that was the fun part of the session. Now we're going to get down to very serious business. We have a session. You all know the Shark Tank? Have you seen Shark Tank on... I know they have it on British and American TV, where people come up and pitch their ideas, and the business investors say, yes, I'm in. I'm in for 100,000 rupees or whatever it is. So we're going to have that session. It's a light way to finish the afternoon. So we have sharks, as you have a Shark Tank. The first one will be Shivani. She's already been introduced. The second one is a good friend of mine, Venu Gupta, who is a senior advisor at Yunus Social Business, driving finance for the wash economy, former managing director at the Toilet Board Coalition, expanded the accelerator to 15 countries. Thank you. Take a seat. And he's focusing on sanitation technologies, reuse, innovation, and benchmarking. Founding member of the Fecal Sludge Management Alliance, and he chairs the IWA NSS Non-Sewage Sanitation Specialist Group, and is a senior fellow of WISA and IWA. And he's a very nice person, so a round of applause. And at last minute, we've had a new shark who's come in, who you did meet yesterday. I'm just going to get his bio up on my phone, if I can. But I will introduce him, Mr. Madhusudan Lohia, Promoter Director of Merino Industries. Thank you. It was your colleague on yesterday, so first time to meet you. Thank you. Mr. Madhusudan leads Merino Industries, one of India's most trusted names in surface interiors and now into next generation sanitation. We heard about the work that Merino is doing. He's pushing for sanitation, taking it from the bathroom to the boardroom, backing school-led innovation, raising quality benchmarks, and improving sanitation engineering. All three are very experienced working with startups. And so we're going to give them the chance to listen to presentations. I am going to invite the first one, which I believe is Smita. Smita Singhal is a founder and director of Absolute Water and the creator of India's first 100% organic Absolute Worm Filter for wastewater recycling. Included within the Prince Charles, King Charles now, Sustainability Initiative, UNDP, Aqua Foundation, and Toilet Board Coalition. I'm not going to talk anymore because we want to hear from you.
Hello. Good afternoon, everybody. My name is Smita Singhal. Yep, sorry about that. In many places, sanitation systems don't break. They simply just never existed. So we have built one that arrives on wheels. So I'm here to present AquaGo, which is our mobile nature-based wastewater treatment sanitation designed for immediate deployment and in communities where sanitation challenges threaten health, groundwater, livelihoods, and climate resilience. Across Africa and Asia today, over 80% of wastewater is discharged untreated, contaminating rivers and all water bodies and drinking resources. Children do fall sick, as we all have been talking about it. Women walk further for water so that they can just get that 1 liter of good water. And our cities are drowning in pollution, as we all are part of that. The need is not in the future, it is now. So AquaGo is built for exactly these environments. Next slide, please. So what is AquaGo? If we could just click on that GIF, that would be fantastic. If not, then we can move ahead. So what AquaGo is, it is a fast mobile nature-based system. AquaGo is a plug-and-play mobile wastewater treatment plant powered by Wormy biological filtration, operating without chemicals. It is zero sludge, zero odor, and zero noise. It has minimal electrical requirement. It works on solar panels and producing safe, reusable water for agriculture, horticulture, construction, flushing, and community maintenance. It is modular, it is low cost, it is lightweight, and can be operated within an hour of play. No sewer network is required, no heavy machinery, and no specialized operators. Next, please. AquaGo directly solves the 4 biggest barriers across the global south. One is unplanned settlements and no pipeline infrastructure. So AquaGo works anywhere. Villages, peri-urban belts, camps, schools, markets, and climate migration zones. Second, unreliable power and harsh field conditions. The system runs on biology, not pumps or chemicals. It is stable even in low energy, high turbidity, and extreme environments. Shortage of skilled labor being third, designed for local youth and women-led operations with basic training, building community ownership. It is that simple to operate. The fourth is need for water reuse to fight water stress. AquaGo produces usable treated water, reducing dependence on groundwater and tankers. The treatment water time is within 45 minutes of press play. The combination is rare, resilient, and perfectly aligned with SDG 6, and it involves cooperation and community-led management. Next, please. So I started my, sorry, the previous slide. So Absolute Water, my company, I started in 2016. We are at TRL 9, and we've been government tested, and we have already scaled, where we have already installed 32 plants in India, ranging from a capacity of 10,000 liters going all the way to 2 million liters. We have worked with institutions, with RWAs, with communities, with the government and state sewerage boards, with the municipal departments, and with the local water supply government authorities, and with resorts and hotels. We have already treated about 6+ million liters, and we are very high in performance because it can operate between temperatures of 2 degrees to 55 degrees, low OPEX, which is less than rupee a liter, and it's 100% of water recovery, so there is no wastage. The carbon saving for example, for a 250,000 liter plant is 23 metric tons. AquaGo is already deployed in similar conditions in Africa and Asia, where the settlements are dense, religious gatherings, labor colonies, construction sites, and climate stress regions. This is not a prototype. This is a battle-tested, field-hardened solution ready for export and scaling. So very quickly on the next slide, please. AquaGo is structured for rapid scale, and there are 3 deployment pathways where we basically can do the CapEx and AMC, which is a one-time purchase and annual maintenance. So it is great for government, institutions, developers, industry events, and humanitarian projects. Part 2 is water as a service, as we've all been talking about, where the clients pay a per liter treated cost, eliminating upfront capital barriers. The third is what we've all been talking about, is about blended finance, where it's PPP, which is the buzzword for today, which is again ideal for all of the global south, for Africa, specifically through donor and government and enterprise ownership. Our unit pricing, as you can see, is that we are able to sell it for about 20 lakhs per 20,000 liters of treated water. We have a gross profit margin and subscription monitoring and an AMC revenue anywhere between $1,000 to $3,000 per unit per year. And the unit highlights very quickly is that it can treat anywhere between 10 to 50,000 liters a day per unit. We can get our treated water in 45 minutes, and it can be deployed within 48 hours of coming onto site with a payback period of 2 to 3 years, which is the ROI. So my final slide, I would just like to say AquaGo delivers fast, reliable, climate-resilient sanitation where it is needed most. Villages, settlements, camps, schools, markets, crisis zones, and growing towns across Africa and Asia. It transforms wastewater into opportunity for health, clean water, women and youth-led, green jobs, and measurable SDG progress. AquaGo is investment ready, deployment ready, and impact ready today. Thank you.
Great. Wow. Round of applause. Thank you. Now stand here, Smita. The Sharks are going to say whether they're in or not. If they're in, you give up to 3 reasons why you are, and you can say how much you might be theoretically in form, I'm afraid, just theoretically. But if you're out, just 1 or 2 reasons. Be kind, yeah? Smita's got a long way to go home, so she wants to go home feeling good. Venu, over to you. You go first.
I'm in. I think water as a service is one reason. I think it avoids customers putting up CapEx. I think that's a very good innovation. Second is it comes from a track record of, so there's a solid track record there. It de-risks the investment. And I think third reason, which, if I'm allowed to ask a question also, I think There could be many segments here, but I think for water as a service, would be also interested to know which customer segments you are looking at from a go-to-market perspective.
Predominantly, like right now, for example, we are talking to DDA, which is Delhi Development. So they want to adopt this technology for 45 water pond rejuvenation. So what happens is they get the ability to move that around. So they don't have to put in capex. So this way it is water per service because it is per liter with a minimum guarantee for sure, because you know flows keep going up and down all day. So we ask for a minimum guarantee, and then in addition to that, whatever we treat, we get the per liter cost or per KL cost as a part of the O&M, and a subscription fee as well.
Great. You've got one shark. Let's see if you can get two. Go on, Shivani.
From the social sector's point of view, because we are the CSR group, so obviously such huge investment may not be a part of our direct intervention, so I am out because of that. But I would definitely like to understand how you can actually make it as a scalable model for the community, because you talked about schools and you also talked about community, so how we can use this technology to actually implement and use it for the CSR initiatives, wherein we can talk about sanitation and water as a major issue.
So it's, for example, like within say about 50 kilometers or 100 kilometers, if you have say 3 schools, that one unit can actually go from school to school, treat it for the day, go to the next, and fill in the treated water for the day, then go on to the next one, So that one unit can do a total, cover that area. So 3 schools in a day can be, be used for sanitation purposes, and that water can be reused for horticulture, it can be used for future construction in the school, it can be, of course, used for toilet management and for any kind of, maintenance of where water is needed. And bathing, of course.
Shivani, are you still out?
Yes.
Okay, brave, good choice. If you want to go?
I think I'd be in, because I think this is it's a very nice idea, and the ability for things to be moved around and to service certain things in a cluster is pretty nice. There may be a few more questions, but that is for more detailed understanding of especially the input that goes into this and how the mathematics were arrived at. But in general, as a concept, and even if it is from CSR perspective or from a natural perspective, if it's if the return is within 2 years, I think that's also excellent.
Yes.
Of course now water conservation and to being net positive in terms of water, I think is every corporate they ought to be thinking in that manner. So from that perspective, definitely yes.
Sure. If I could just really quickly butt in, if I have 2 seconds, is basically why we're providing a mobile treatment plant is only because of the fact that you don't have to invest in a structure, in a permanent structure. Because if you do that, the maintenance is quite high for that, and when, for example, if it doesn't work for some reason, or the maintenance is not happening, then that shuts down. So that affects the community around. So the point of the mobile system is that you don't have to kind of get into a permanent solution, and water is being treated on the spot. So there is no sewage being transported back and forth, and plus you're getting treated water on the spot. So that's the main idea behind it, basically.
Well, Smita, you got 2 out of 3, which ain't bad, as the song goes. Well done. Thank you, Sharks, and well done, Smita, and good luck with your business.
Thank you. Thank you so much.
Thanks. Round of applause. Okay, now we have our next entrepreneur who's going to make a pitch, who is Imad Aghi. Imad is the founder of EcoLoo and a global leader in sustainable sanitation. He is a UN top 10 global innovator with 30 plus years, sorry, you look younger, 30 plus years of international awards. He pioneered waterless and ultra-low flush, 200 milliliters toilet technologies, which I'm sure we're going to hear about. His solutions have redefined water conservation and proved that sustainability and profitability can grow together. Let's see what the Sharks make of you.
This is the one? Yes. You may call me the Loo King. What will you call me? Sorry? Higher, louder? Okay, that's okay. Well, do you want to hear the Lou King story? Nobody wants? I can't hear it. You are sleeping, man. All right. Well, the whole thing started a few decades back when I was watching a Swedish documentary about Indian sanitation crisis, and where it showed a scavenger woman barefoot collecting human waste with her bare hands, no gloves. Her exhaustion, her silent suffering, her short, painful life, it broke something in me. And I still have her in my memory. And wakened something stronger. That moment sparked a mission to restore dignity, protect water, and build a solution that could change lives. The journey was meaningful, but tough. Sleepless nights, financial strain, and constant doubt from people who couldn't see the vision I have. But I was not building just a business. I was building an impact-driven Sanicon. Where's the guy? There. A one-stop platform for sustainable water, sanitation, hygiene, and health solutions. My family and I made huge sacrifices, funding everything ourselves through our construction business and our pocket. I spent years traveling away from my children to help Ecolo grow. It was my baby. I designed a solution that delivers dignity and simplicity. No smell, no touch, no sight of waste, no digging, no piping, no maintenance. It's like it's too good to be true, but it's true. And a valuable liquid fertilizer as the end product. Safe, water-saving, and environmentally sound solution. Next, please. That are some of the solutions. Oh, yes, I have it here, actually. Sorry. Those are some of the solutions we have, but we have many more, and I will show you. We are launching our new website and premium line of sustainable hygiene essentials in the next month as well. This solution you see here is the only most efficient flushing toilet in the world. It flushes only 0.1 liter of water on pee and 0.2 liters on poop. It's like a coffee cup. Those are the products we have also in the pipeline. So we have like a one-stop solution, as I mentioned. We never used PR or advertising. We focused on real impact. We are now investment ready, having developed 18 innovative products and IP rights for indoor, outdoor, school, rural community, and even high-rise environments. We have been recognized by UN bodies, governments, global organizations, sustainability leaders, and the communities whose lives we have transformed. Awards and invitations have followed because Ecoloo worked there, others failed. This is Ecoloo, the #1 in #2 solutions, and a global pioneer in decentralized, sustainable waste management. Enjoy the music.
Plastic climbs so high. We look for answers beneath the sky. A throne that's green, a change of pace. Ecoloo's here to save this place. Say goodbye to the waste we know. Flush your guilt and let it go. Planet's calling, time to care. Ecoloo love is everywhere. From the earth we took and more we gave. Now it's time we all behave. The biodegradable dreams we share. Ecoloo legends we declare. Dripping beats like hope alive. Harmony sink in overdrive. Each flush a promise, each step a feat. Ecoloo rhythm under our feet. Say goodbye to the waste we know. Flush your guilt and let it go. Planet's calling, time to care. Ecoloo love is everywhere. Hear the echo through the breeze, a future blooming endlessly. On your throne, your saving grace. Ecoloo love replenishes space. Say goodbye to the waste we know. Flush your guilt and let it go. Planet's calling, time to care. Ecoloo love is everywhere. Ecoloo love replenishes space.
Thank you.
Thank you. A wonderful presentation.
Thank you, thank you.
We are under a time constraint now because we have a VIP arriving and we need to do certain protocols. So I'll give you each just a brief moment to say in or out and a couple of points why. Please.
Oh, it's in. We happen to know each other from before, and there are some things I think very worth getting into. So definitely, and I'm not going to take more time than that.
Great. Thank you. Might be a conflict of interest, but good. Shivani, go ahead.
I'm in because of the toilets which you are constructing. We would definitely like to experiment with the rural community. Yeah.
Thank you.
I'm in as well. I think it's a systems approach. It just doesn't stop at waste capture. You know, it seeks to treat it as well. Decentralized, modular, can be assembled and manufactured in various places. So.
Great. Thank you. Well
Thank
done.
you.
3 out of 3.
Thank you. Thank you very much.
As good as you can get. Great. Yeah, so just conscious of time, I'm going to invite the final entrepreneur, who is Dr. Divya Rathod from Silvria Nanos. I'll give a brief introduction if I can. So Dr. Divya is a 2-time PhD scholar, former CEO of WISE SNOT's incubator and founder of Silvria Nanos Innovations. Very welcome, and I'll let you do your presentation. Thank you.
Hello. Changing? Slide. Hello, everyone. Cleaning toilet every day is such a big problem, right? But if you get clean, hygienic, waterless, infection-less toilets with minimal cleaning, isn't a good solution? Yes or no? Yeah. So Silvery Nano's innovations brings that solution to you called Happy to Protect. So the story, I'll tell you. All the girls who are sitting over there, do you love to like sit on the toilets comfortably? And but the UTI is a very big problem, right? You will just try to float on the toilets and do the loo. So that's the whole thing which I faced. I suffered from UTI in 2014 when I was doing my bachelor's in microbiology. And then I decided, and being a person from microbiology, I always think about microorganisms. All the microorganisms are really roaming around me. How, being a Jain, again, because my philosophy, that I don't have to protect the microorganisms, I don't want to allow them to grow, which is called as a bacteriostatic effect in microbiology. So you do not allow the microorganisms to grow on the surface by creating a film on the surface, which used to be like silver in the previous times, in the king time, but now we have nanoparticles. Everyone is aware about that? So we create nanoparticles which will be on the surfaces, which will create bacteriostatic as well as water and stain repellent with antimicrobial effect for almost a month. Isn't that great? Yes. So yeah, so I started my journey from doing my bachelor's and PhD, my bachelor's in microbiology, and then I ended up doing PhD. That was my I had to. So then on the same surface, because I was facing this particular problem, and then the COVID happened, and everyone's microorganisms everywhere, and then we started with Happy to Protect with multiple surfaces. And when we came in COVID, we were given by UNDP, UN Women. We were awarded by a lot of organizations for giving the nanoparticles to Indian Army, to different organizations. And we sold up to 40,000 liters for the toilet specifically. And this particular nanotechnology does not even save the microorganisms, but also saves water up to 29%. Isn't that great? Because it is water and stain repellent, and also the chemicals which are there in our environment. So the chemicals, we use Harpic, we use phenols, we use acids, which gives a lot of fumes. It goes in the environment, creates a lot of hazard, and also, the microorganisms being affected. So we also save the chemicals from the environment. The problem, of course, 150 million people suffers from UTI, that is urinary tract infection, in the world every year. That's a very big number. And I have suffered myself. Every girl like me is always, very much afraid of being UTI because I lost almost 10 kgs. Now I gained around 20 kgs. But I lost almost 10 kgs. I was in a very bad pain. I couldn't go to college, my microbiology practicals, for almost 2 months. And that was the time when I decided that, okay, let's do something over there. Of course, water and sanitation, it also saves water. The multi-drug resistance. Before, I used to take around 6 months of medication when I got UTI in 2014. And now that medication has gone up to more than 12 months because of multi-drug resistance. So it's a very big problem which we have to solve. And the sanitation worker was going to be the one. The environment, of course. The solution, of course, Happy to Protect toilets, environment, being bacteriostatic, water and stain repellent, spray it once and have a protection of almost a month, and environment safe. Of course, the current market solutions, we have acid phenyl sanitizers. Everyone been using the sanitizers. We are different than sanitizers. We are nanotechnology. We are using silver nanoparticles. We are using antimicrobial nanoparticles and a different nanoalloy, which allows the nanoparticles, basically, you can say in Hindi, "Aap chandi ke pot pe baithe ho." So you are sitting on a silver pot, and that silver pot is going to help you prevent infections and also save water. But, I know the silver rate is going a lot high, right? And I also invested in silver, being Silvery Nanos. But you can only have, the nanoparticles does not cost much, so you can have per seat around less than $1. So it's just 80 rupees per month. Now we have our target segments, of course, the distributors, we have government tie-ups, we have been working with Ministry of Housing Affairs. We did our pilots in Hyderabad, Mumbai, Warangal, and Delhi, so number of places we did that. The facility management, of course, the traction between the BVG, and we are also looking for the facility management to tie up. So we have already in talks with BVG. Hospital protections, we did that in COVID. Our team, of course, I'm being a microbiologist, and then we have a CA, then we have a sales agent, and then we have a postdoc ICT chemical engineer with us, and the whole team of around 25 people. We did Nari Saf Toilet Ki Savari, which got attraction from WITF, that is in China, which we were selected for 100 top projects in the world. We got also World Bank Water Solutions, we will be selected for the top 20. And we did a pilot project on Mumbai stations, and then a number of pilot projects working with the sanitation worker in Warangal. These are our awards and recognitions from different universities and the ongoing projects. So currently we have been working on the CSR project, where we are not even doing the Happy to Protect toilet, but we are actually involving a lot of other solutions, which is called Happy to Anti-Skid, so you don't slip in the toilet. Happy to Waterless and Odorless Urinals, so it uses a very less amount of toilet. We have Happy to Sanitize, which is not an alcohol sanitizer, but nanotechnology sanitizers. We have a tablet also, small tablet, which you don't have to flush the toilet, you just have to put the tablet, and it will be antimicrobial and a blue in color. So you don't have to see the yellow color in the toilets. And we also did a pilot with MOA, and we are doing a CSR project on the Parel railway station in Mumbai with Central Railways. The ongoing project, I'm also a consultant in British Council. I was just, I just stepped out from CEO of Wise SNDT Group, so I have projected around 10,000 women, girls, for the projects and for being a mentor on them. The impact created, of course, we preventing UTI. We are saving up to 55% of water and chemicals, giving a bacteriostatic effect on the toilets. Preventing upcoming pandemic, because I always feel wherever there are microorganisms, bacteria, the viruses will flow, and of course, they will multiply and grow. So preventing MTR in microorganisms, the climate change, of course, by saving chemicals, and the facilities, and also the soil. My ask is a lot. So our Sulabh Sachala International President is over here. So I would love to have, Happy to Protect toilets with them, because I'm a big fan of them. 3 facility management, and a funding of 180K from the Sharks, the CSR funds, and of course the Export Connects. The financials are over here. So we do around a 40% margin, and on the profit on the making. Also, being a microbiologist, we have been doing every month a cleaning check. So now there is a patented product where you can detect E. coli in 6 hours. Before it used to be 24 hours, but now you can detect the E. coli in 6 hours. So we have been using that to check whether the microorganisms are growing on the toilets or not. So you will be getting the service, so microbiological services for the same. So we are proposing 2 of the products. One is Happy to Protect toilets and microbiology as a service. These are my personal achievements, overwhelmed with all the awards and the Startup India and all the cultures. And thank you so much.
Great, fantastic, lots of energy, well done. Very quickly, please, in, out, and a few comments, and then we'll wrap up. Thank you.
I'm in. I would like to definitely explore it specifically for the community toilets initiatives.
Sure. Thank you so much.
I'm in, especially that point about the UTIs, etc., came out in a lot of researches that we've done. In fact, women tend to not drink water also,
yes,
in order to avoid going to restrooms and so on, which leads to other problems. And about we've done some experimentation with another partner associate for urinals, waterless urinals, etc. So I think this is exciting space for us as well. Looking forward to discussing with you.
Sure, thank you so much.
Thank you. 2 out of 3 so far.
I'm in as well. I think apart from the points mentioned there, I think it's a great public toilet solution, lowers the O&M cost, requires 1 clean every month, so I think it's very, very powerful.
Thank you,
Well
thank
done.
you so much.
Thank you very much. Thanks, and a round of applause for all of the entrepreneurs who presented and put in a lot of energy and personal commitment. Thank you very much. I think we're handing over now. Thank you.
Thank you so much, sir. With this, I'd like to request you to kindly take a step forward for the group photograph. I hope here are the glasses that you are looking for. Yeah, here it is. And I request all the panelists of this particular session, part 1 and part 2, to please come on the stage quickly. We would like to do the felicitation. And I request Shri Kumar Dalip and Mr. Jack Sim to please join us on the stage for the felicitation. Let's have a round of applause for all of them. I request all the panelists to please come on the stage, both of part 1 and part 2. And here we would like to present to you the mementos. May we please have the mementos on the stage. After this group photograph, we would like to present it. Let's have a round of applause for all these wonderful dignitaries. We are thankful to all those dignitaries and would like to present this memento from our side to them as a token of gratitude from our side. Here it is for our dignitaries. We must have your continuous round of applause for all the dignitaries. They have done quite a wonderful job. And so much interactive, I must say. So many silver shines on the stage we can see. Wonderful, wonderful. Now this is how we show gratitude in India. Let's have a thunderous round of applause for all of them. Thanks a lot, sir. With this, I thank all the dignitaries and I request you to please take your seats at the front. And I would request Mr. Jack Sim and Shri Kumar Dalip to please be here on the stage with us, because now we have got a special acknowledgement and special recognition. Here is the Hall of Fame Awards. So I would like to share with you that the Hall of Fame Awards celebrate extraordinary individuals whose dedication, innovation, and leadership has created a lasting impact in their fields. And more than just recognition, these awards honor a legacy. So that is acknowledging those who have gone above and beyond to inspire change, elevate standards, and pave the way for future generations. Each inductee embodies excellence, resilience, and commitment to service, making the Hall of Fame not just a tribute, but a testament to the power of visionary contributions that shape our world. Let me please share with you that earlier we had the awardees into this Hall of Fame. The earlier awardees were Amina Mohammadji, Mr. Jen Eliason, and the President Muhammadu Buhari, and also Dr. Bindeshwar Pathak. So, एक बार तो हमारे जो पहले awardees रहे हैं उनके लिए तालियां हो जाएं. And this year, from World Toilet Organization, this Hall of Fame awardees are the 3 awardees, and I would like to take the name first and foremost, the gentleman who is over here on the stage with us, Shri Kumar Dalip, the President of Sulabh International Social Service Organization. May we please have the Hall of Fame award over here. Mr. Jack Sim is going to present this to him. This is such an honorable moment for all of us. And now I would like to invite Mr. Chaplop Pasu from Bhutan Toilet Association to please come on the stage to receive Hall of Fame. Welcome, sir. Let's have a thunderous round of applause for him. He is also our Hall of Fame awardee, Mr. Chaplop Pasu, Bhutan Toilet Association. Here it is for you, sir. Let me share with you that the 3rd awardee is Mr. Nurken, Rector, Miraz University, Kazakhstan, but he couldn't be here because he couldn't get visa. There was some issue with that, so that is why he's not here. But I would request Ms. Leila from WTO to please receive the honor on behalf of Mr. Nurken. Please put your hands together for Mr. Nurken and the recipient on his behalf. Thank you so much. This is such a wonderful moment. So here is a very important announcement. Thank you so much, sir. Here is an important announcement for all of you that Honorable Chief Minister of Delhi, our chief guest for the valedictory session, will be arriving here soon. So before that, as per the security protocol, we all have to vacate this auditorium, and we'll be back here dot at 4:15, because then we'll be starting with the valedictory session. Honorable Minister will be joining us, Honorable Chief Minister will be joining us, and Honorable Mayor of Delhi shall also be joining us. So I would like to request you all kindly vacate the hall for the security protocol. At 4:15, we'll see you back in the auditorium. So we have to be back by 4:15. We cannot delay that. I would request you, please take all your belongings with you, because security protocol के हिसाब से हम सभी लोगों को ये auditorium खाली करना है. So kindly take all your belongings with you. Don't put anything on your seats or something. The security people are coming now for the security check, and you'll be back here dot at 4:15, and then we'll be starting with the valedictory when we'll be joined by the Honorable Chief Minister of Delhi. Thank you so much. Please make sure आप सभी लोग अपने bags वगैरह सब अपने साथ लेके जाएं. Please take all your belongings with you. Do not leave anything. Auditorium में bag, बस्ता कुछ भी छोड़ के मत जाइए. अपनी सारा सामान अपने साथ लेके जाइए. और 4:15 बजे दोबारा यहाँ पर हम लोग मिलेंगे, क्योंकि 4:15 बजे से फिर valedictory session शुरू होगा. दिल्ली की माननीय मुख्यमंत्री महोदया श्रीमती रेखा गुप्ता हमारे बीच होंगी. आप सभी से अनुरोध है कि सिक्योरिटी प्रोटोकॉल के लिए आप सभी लोग ऑडिटोरियम से बाहर जाएं और अपना सारा सामान लेकर जाएं. यहां पर कोई सामान ना छोड़ के जाएं. थैंक यू सो मच.
Hello, hello.
Once again, a very good evening to all of you. I take this honor to share with you that in a few minutes now, we'll be joined by Honorable Chief Minister of Delhi, Srimati Rekha Gupta, and also we'll be joined by Honorable Mayor of Delhi, Mr. Raja Iqbal Singh, and Mr. M. David Mahalobo, Honorable Deputy Minister, Department of Water and Sanitation, South Africa. On their kind arrival, we'll be starting with the scheduled program, so you all are requested to take your respective seats. आप सभी से ये विनम्र निवेदन है, कृपा करके अपना अपना स्थान ग्रहण कर लीजिए। अब से कुछ ही देर में दिल्ली की माननीय मुख्यमंत्री महोदया श्रीमती रेखा गुप्ता का आगमन होगा। उनके आते ही कार्यक्रम विधिवत आगे बढ़ाया जाएगा। You all are requested to please keep your mobile phones on silent mode. आप सभी से ये विनम्र निवेदन है, कृपा करके अपने मोबाइल फोन्स को साइलेंट मोड पर रखिएगा। धन्यवाद। too much. Once again, a very good evening to all of you. I request you kindly settle down and please keep your mobile phones on silent mode. आप सभी से अनुरोध है कृपा करके अपने मोबाइल फोन्स को साइलेंट मोड पर रखिए. We are soon going to be joined by our chief guest of this valedictory session at World Toilet Summit 2025, Honorable Chief Minister of Delhi, Srimati Rekha Gupta. On her kind arrival, we'll be starting with the scheduled program. So you all are requested to please take your kind seat. Friends, in any moment now, we'll be joined by the chief guest of this valedictory session of World Toilet Summit 2025, Honorable Chief Minister of Delhi, Srimati Rekha Gupta. On her kind arrival, we'll be starting with the scheduled program. In the meanwhile, once again, I would like to recall all of you, please keep your mobile phones on silent mode. कृपा करके अपने मोबाइल फोन्स को साइलेंट मोड पर रखिएगा। अब से कुछ ही देर में दिल्ली की माननीय मुख्यमंत्री महोदया श्रीमती रेखा गुप्ता हमारे बीच यहाँ पर होंगी और उनके आते ही कार्यक्रम विधिवत आरंभ किया जाएगा। आप सभी का हार्दिक स्वागत है। I extend my heartiest welcome to all of you to this valedictory session of World Toilet Summit 2025. Welcome. Here is a kind announcement for all of you that Honorable Chief Minister of Delhi, Srimati Rekha Gupta, has already left for this particular summit. So she is about to reach any moment now. In another 10 minutes or so, she is going to be here with us. और उनके आते ही हम कार्यक्रम आरंभ करेंगे. माननीय दिल्ली की मुख्यमंत्री महोदया अपने निवास स्थान से निकल गई हैं और अब से 5 से 10 मिनट के भीतर वे हमारे साथ आज के इस कार्यक्रम में होंगी. उनके आते ही कार्यक्रम विधिवत आरंभ किया जाएगा. तो आप सभी से एक बार पुनः निवेदन है, अपने मोबाइल फोन साइलेंट मोड पर रखिएगा. And please maintain the decorum because in a few minutes now we'll be joined by our chief guest. Thank you so much. Our chief guest is about to arrive in any moment now, and as on her kind arrival, we'll be starting with our scheduled program, the valedictory session of World Toilet Summit 2025. These 3 days have been really, really fruitful for all of us, and how we all have taken up the thoughts, the visions, and the ideas that we have not only spoken about, but we are also going to implement them. So once again, I welcome all of you to this valedictory session. In a few moments now, we'll be joined by our chief guest, Honorable Chief Minister of Delhi, Srimati Rekha Gupta. She's going to be here, and on her kind arrival, we'll be starting with the scheduled program. Once again, most welcome to all of you in this valedictory session of World Toilet Summit 2025. In any moment now, Honorable Chief Minister of Delhi, Srimati Rekha Gupta, is going to be here on the stage with us on this platform of World Toilet Summit 2025. She is the chief guest of this valedictory session. On her kind arrival, we'll be starting with the scheduled program. It's a kind reminder to all of you to please keep your mobile phones on silent mode, and we should be all very much attentive towards the stage, because now here we are gonna explore all those ideas that we have discussed in the past 3 days, like including today. And this valedictory session is going to sum up all of that together. So I request all of you kindly maintain and please put your mobile phones on silent mode. Thank you so much. आप सभी से अनुरोध, कृपा करके अपने स्थान पर बने रहें। अब से बस कुछ ही देर में हमारी आज की मुख्य अतिथि महोदया का आगमन होने वाला है, तो आप अपने स्थान पर बने रहें। उनके आगमन के साथ ही हमारा जो कार्यक्रम है वो विधिवत आरंभ किया जाएगा। एक बार पुनः आप सभी का अभिनंदन और बहुत बहुत स्वागत। वर्ल्ड टॉयलेट समिट 2025 का ये जो हमारा वैलेडिक्टरी सेशन है, समापन समारोह है, इसमें हम आपका बहुत बहुत अभिनंदन करते हैं। आप सभी को सूचित करना चाहेंगे कि हमारे आज के कार्यक्रम की मुख्य अतिथि महोदया इस परिसर में पधार चुकी हैं और अब से कुछ ही देर में हमारे साथ यहाँ मंच पर उपस्थित होंगी. I would like to share with all of you that our chief guest of the occasion has already reached premises and shall be here on the stage with us in any moment now. On her kind arrival, we'll be starting with this valedictory session of World Toilet Summit 2025. In any moment now, we are expecting our chief guest to be here on the stage with us. Ladies and gentlemen, we are joined by Honorable Chief Minister of Delhi, Srimati Rekha Gupta. Let's have a thunderous round of applause for her welcome. Let's hear it for her welcome on this platform of World Toilet Summit 2025. We welcome you, ma'am. We are so much honored that you are here with us in this World Toilet Summit 2025. Most welcome to this wonderful session, the wonderful summit. Ladies and gentlemen, let's have a thunderous round of applause for the welcome. Thank you so much, ma'am. We all are so much grateful that you are here with us on this platform of World Toilet Summit 2025. Please accept our gratefulness that you are here with us. Thank you so much. And I would also like to invite on the dais our special guest, Mr. M. David Mahalobo, Honorable Deputy Minister, Department of Water and Sanitation, South Africa. Please put your hands together for his welcome. I would also like to invite on dais our guest of honor, Mr. Raja Iqbal Singh. He may be joining us soon. And Professor Dr. Indra Chakravarti, Padma Shri recipient, she is here with us. Let's have a round of applause for her welcome. On the dais, we have with us Mr. Jack Sim, founder of World Toilet Organization. Mr. Kumar Dilip, President, Sulabh International Social Service Organization. And Mrs. Nitya Pathak, Executive Convener, Sulabh International Social Service. Thank you so much. Once again, I am Shilpa Bhavna, and I bow down to all of you and present my heartiest welcome to all of you in this valedictory session of World Toilet Summit 2025. Since our dignitaries are here, और हमारी संस्कृति में अतिथि सत्कार को हमेशा सौभाग्य कहा गया है, तो हम चाहेंगे कि ये सौभाग्य प्राप्त करने का अनुभव हम सभी लोग ले सकें. So I would like to request Mrs. Nitya Pathak to kindly present the shawl to our chief guest. May we please have this warmth over here on the stage. Ma'am, we formally welcome you to this World Toilet Summit 2025 और हम चाहेंगे कि ये गर्माहट हमेशा आपके साथ बनी रहे और ये हमारी ओर से एक शान है आपके लिए, मान का प्रतीक है आपके लिए. I request Mr. Jack Sim to please present the memento to Srimati Rekha Gupta. I would request Mr. Jack Sim to kindly present the shawl to Mr. David M. Mahalobo and welcome him formally to this valedictory session. Here it is, sir. Shri Kumar Dilip is also requested to present the memento to Mr. M. David Mahalobo. We are so much thankful that you are here on this platform with us in this valedictory session. Thank you so much. Thanks a lot. And my dear friends, as we all know that today is the valedictory session of World Toilet Summit 2025. Pichle 3 din se we all have been working towards getting some good ideas, greater ideas and converting it into action. And we all have been committed to transform these things into a really good change. So today is the conclusion of the 3 days of global deliberation. We are so happy. And to start with, I would like to request Dr. Sutirth Saharia, Senior Vice President and Head of Communications, Sulabh International, for doing a presentation as a welcome and context setting and reflections on this summit. So please welcome him. His presentation is on the WTS Way Forward, Next Steps for Global WASH Cooperation. Over to you, sir.
Well, ladies and gentlemen, it's a kind of an honor for me to stand before you in this grand finale of this 3-day seminar. For those in the organizing committee, this is where the celebrations begin to simmer, So ladies and gentlemen, roughly or approximately 131 days ago, 13th of July, 2025, Jack Sim swooped into New Delhi with his team, Laila and Sarika, who have now become wonderful friends, to discuss summit talks with the president of Sulabh International, Kumar Dilip. And that's how this journey began, 131 days back. My job was to find the title of the summit and to justify why it should be New Delhi. I had the privilege of working with one of the greatest men I've ever known, Bindeshwar Pathak. It was only in 2010 the UN recognized sanitation as a human rights issue. Dr. Pathak did in 1970. And if you look at the Sulabh logo, you see a lady and you see the toilets. He made that connection. The dignity was at the heart of it. The Sulabh sanitation movement that began in 1970, the essence of that movement has been always dignity. Dignity of everyone. Hence, we got the title of the summit, collective responsibility, because it's always going to be our collective responsibility for the dignity of ourselves, yourselves, and now for the planet. Now, why New Delhi? I think we had an answer for that already. This is the city where the Prime Minister of India, Narendra Modi, in 2014 gave that clarion call that war against sanitation must be fought on a war footing. Now we have a great leader with us, Rekha Gupta, who is increasingly integrating the best sanitation practices in the civic framework of the city. New Delhi is also the capital of the world's 4th largest economy, leading 1.4 billion into a great future of developed India, Viksit Bharat by 2047. Once again, it's an honor for us to have the leader who is leading us into that future. So a great round of applause once again for the Madam Chief Minister. Minister Mahalobo, as a communication specialist, I've become your fan. Your presence, active participation of the last 3 days has been truly inspiring. You have actually put ornaments around the topic of sanitation with your eloquent speeches. You spoke not only as a policymaker, but as a global citizen concerned about inequality, about conflict, about climate change, and the unmet commitments of the international community. Your remarks reminded us that the sanitation is inseparable from justice and peace. New Delhi, as a capital, as India, we champion the voice of Global South. We believe in self-determination. And thank you for resonating those words. So we began this summit, we had great, representative. The structure of this summit stood on 4 pillars: government leadership, global philanthropy, United Nations, and the corporate sector, and the community as well. So right at the beginning, we had Sri Manohar Lal, the Honorable Minister of Power and Housing and Urban Affairs, who reminded us that a village builds a toilet, but the world builds an environment. Then we have Mr. C.R. Patil, the Honorable Minister of Water Resources, Jal Shakti, who highlighted the urgency of the last mile service delivery, saying, he cautioned that water scarcity, population pressure, and declining groundwater must reshape our sanitation priorities. We also had the Alkesh Wadhwani from the Gates Foundation. He made a statement that sewers cannot keep up the urban sprawl. Reinvented toilets and non-sewer solutions are essential for the next decade. And we had the United Nations voice, who underscored that sanitation is both economic engine and a climate solution. So during the course of the last 2 days, we navigated through 7 sessions, really. 7 sessions touching on different aspects of the sanitation. And just to give a recap, I'm not going to get much into the detail, it can be a bit boring. But then we had India stories yesterday. We heard the stalwarts of the government speaking. And in that session, the speakers emphasized that progress over the next decade will rely on deeper partnerships, corporate social responsibility, blended finance, research institutions, innovators, and on protecting the dignity and inclusion, especially for sanitation workers and vulnerable communities. Then we had another session on climate and sanitation. And that session showed how climate change is placing unprecedented pressure on sanitation systems because of floods, heat waves, rising temperature, and rapid urbanization. The message was clear. Resilience is not just infrastructure. It requires strong service delivery systems, decentralized and non-sewer solutions, gender and social inclusion, protection and recognition of sanitation workers. Then we had a very technical session on circularity of sanitation. We had speakers from University of Surrey, Sanitation Hygiene Fund, IITs, UNICEF, ENOFs, and they all highlighted a few things. We saw breakthroughs in nutrient recovery and urine diverting technologies. We saw India's first field testing platform at IIT Palkad, the economic and social power of women-led sanitation enterprises, the growing importance of decentralized, non-sewer climate resilient sanitation systems. Technical terms, but well. Then we had the health session. And that session kind of touched on some very critical issues that we already know about. But it talked about the climate change in accelerating waterborne diseases everywhere, even in richer countries. Portable and non-sewer toilets that can prevent outbreaks in high-risk, low-infrastructure settings. Neglected topical diseases that persist because sanitation gaps allow worms and parasites to thrive. They also talked about leadership, community partnerships, local models like Sulabh, that are key to sustained health gains. Then you had a very special session by the Ministry of Housing and Urban Affairs, the MAHUA, that's they're known as. They reaffirmed the national goal of manhole to machine holes and 0 deaths in sewer and septic tank cleaning. And we had presentations from several cities They talked about the Namaste scheme and related programs that are supporting Safai Mitras with health checkups, insurance loans, training and dignified rehabilitation. Then we had the final session, the session on sanitation, economy, and private sector, which was a very engaging session today, this afternoon. And they talked about that sanitation now is a service, not just a toilet. The focus is shifting from infrastructure to operations, reliability, user experience, and long-term service delivery. So these are some of the, in short, a summary of what we heard in the last 2 days. Now, in my conclusion, I mentioned about 131 days. Means there are many people who have worked immensely hard, very hard for the last 131 days. Before I was coming into this auditorium, a journalist outside asked me, whenever I come to Sulabh, I always see the same people. Why? I said, people in Sulabh do not work for an organization. They work for a mission that was set up by the vision. So in my conclusion, I really want to thank the entire Sulabh family, my colleagues Bela, Gaurav, Sakshi, all of you worked, for the mission of our founder, and you have paid a great tribute. With that note, I conclude my talk, and on the dais, Dr. Chakrabarti, Nitya Pathak, welcome. It's my honor to speak before you. Thank you so much.
Thank you so much, Dr. Sutirth. Remarkably, you have covered all the outlines of the technical sessions that we had been doing from the past 3 days, including this day. And I would really like to say that sanitation is not luxury. It's a fundamental right. Doesn't matter on which part of the country you are, doesn't matter on which part of the world you are. That is why when we talk about the sanitation, it is a global voice. We are so much happy that we had the gracious presence of Honorable Minister of Parliament and Deputy Minister of Water and Sanitation, Republic of South Africa. Since from the day of inaugural in this entire World Toilet Summit 2025, he had been there with us. So now I would like to invite him for his special address. Please put your hands together for Mr. M. David Mahalobo.
Thank you so much, Program Director, Your Excellency Chief Minister to New Delhi, and our Mayor, Dr. Kumar Dilap, Jackson, and all the leadership of the Sulabh International. You are a global movement. You are a movement of peace, but you are also a movement of human development. Your Excellency Chief Minister, when I joined the leadership here, I quoted President Nelson Mandela when he said there were many dark moments when my faith in humanity was sorely tested, but I could not and would not give myself up to despair. That way lies defeat and death. When we're here, we look at the global environment in which we live in, the challenges our people are facing. In the main, the number of conflicts we have in many parts of our world, and we need to silence the guns. And many nations are lagging behind with respect to issues of access to water. More than 2.2 billion people still don't have access to clean drinking water. 3.6 billion don't have access to safe sanitation. And more than 1.7 billion people don't actually have a toilet in their own household. This is the dark cloud that was hovering to many, many people, that yearn for peace, they yearn for justice, and yearn for development. But I'm leaving here back to South Africa, wherein His Excellency President Cyril Ramaphosa has started to receive heads of state and government including his brother, His Excellency Prime Minister Modi of India, that is joining him when Africa for the first time is hosting the G20. I'm no longer having any fears. The story of the Indian people and the story of the government of India, working with all the organization on the ground and leaving no one behind, that it is possible that if you actually rise to the occasion of leadership and be able to turn one of the biggest nations in the world, that we share bonds, not even today, in the struggle for colonialism and apartheid. We have reconfirmed that safe sanitation, clean water, hygiene, and public health are a universal rights that are related to human dignity, socio-economic rights, environmental rights, and security rights. But they are also about climate resilience. As we know that many parts of the world are devastated by the impact of climate change, wherein some of the countries that have made commitments, they've decided not to honor the commitments around climate change or around the commitment on SDG. One of the few issues we're taking home to South Africa is the question of dignity, health, and inclusion first. In the main, the matter of sanitation, we must think so hard about the most vulnerable and the most poorest of the poor. In the main, the biggest burden is borne by women. The biggest burden is borne by children. And the biggest burden is borne by those that are vulnerable on the basis of conflicts that have been displaced, by those that are subjected to displacement on the issues of climate change. Therefore, when we think about sanitation, in our hearts, it must strike us painfully that if those important, vulnerable, and the weakest in our own lives are not taken care of, we don't deserve the future we need. In the Indian experience, we appreciate the role of political leadership. The leadership that made a choice to do something about the plight of the Indian people. It created an enabling environment, and the movement like the SULAP International, the World Toilet Organization, SIMI, have been leading over a quarter of a century. It has been able to make the strides. I was so pleased to look at the involvement of federal government, the issues of the local government, and many community organizations. The third point is about building sustainable sanitation services. In other words, the issues of management of sludge, the sustainable way of managing the system, and how India, we have moved of addressing the question of hygiene as a matter of the body. It becomes the matter of the mindset. Then it becomes a culture. A culture is the way of life, and it's a virtue. I appreciated the issues of interconnection with climate resilience and water efficiency. There is no additional drop of water that is available right now. Every drop of water we waste, someone somewhere else is looking for that drop. Those whose relationship with water is not good, who are trying to hide their secrets in a desert or in the field, that secret one day will land on someone's lips because the drop of water has the capability to traverse miles and miles and land on someone's lips. One of the major issues that we take home is that waste or human excreta is no longer waste, it's the new economy. We can invest in this new economy to ensure that we power our homes in terms of the hydrogen energy. We ensure that we industrialize and build new products out of waste, such a way that we can be able to have fertilizers that can make a biggest impact around issues of food security and manufacturing. We go back home, understanding the power of advancement in science, in engineering, technology, that these advances that are there, we must embrace innovation. We must embrace that there are new ways, especially in the industrial revolution, in the digital economy. It makes life much easier. Therefore, the deployment of technology must be about solving humanity's problem, rather than developing technology for confrontation and for conflict. Therefore, issues of innovation assist us. The matter of partnership, I was heartened when I could see a global company like Uber driving change and dignity. Then they demonstrated here and their contribution. More importantly, thinking about the vulnerable workers that are working in the sanitation services. They too, under the sun, must be respected in terms of human rights, in terms of their safety and their contribution. Then the issue of enabled sanitation markets and the skilled workforce, the training. Every country that takes itself seriously, it must invest on human development. It must invest in young people so that we don't leave anybody behind. Because those of us who are here today, who are inheriting this world as custodians, not on our behalf, but on our forebears, and the near inheritors who are the next children of our children. In my conclusion, I love that sanitation movement. We have changed the relationship between people and toilets, water and hygiene. Our relationship must change. It must be a mutual and symbiotic relationship. We can't be doing vandalism. We can't be throwing things everywhere. We can't be doing issues of criminality. Therefore, the campaigns of teaching them young at schools so that they are living a life that is upright, a life of dignity, and a life of responsibility is an appreciation for this movement. I believe as we are going to close, our shared commitment is that sanitation indeed is a human rights matter, is a matter of dignity. Sanitation is a matter of public health, and sanitation is a matter of climate action, but sanitation is a matter of economic justice, and sanitation is our shared responsibility. Nelson Mandela would have said, when we come together, nothing is impossible. It is in our hands. Let's build a better place for you and me and your children's children. I thank you.
Thank you so much, sir. मित्रों, ये बात तो सच है, यत्र स्वच्छता तत्र सुखम बस्ति. जहाँ स्वच्छता है वहाँ सुख ही सुख होता है. लेकिन उस सुख को पाने के लिए, to get that happiness, we all have to pledge to redouble our efforts towards that direction. मैं अपने आप को बहुत सौभाग्यशाली समझती हूँ कि दिल्ली में चाहे हमारी इलेक्ट्रिक बसेस का जो लॉन्च हुआ था, जो हमारी दिल्ली की माननीय मुख्यमंत्री महोदया ने किया था, या फिर हमारे लाल किला पे एक भव्य नाटक का जो मंचन हुआ था, उसका जो आतिथ्य किया गया था, उन सभी में मुझे मंच पर आतिथ्य करने का अनुभव प्राप्त हुआ है श्रीमती शीला दीक्षित, श्रीमती रेखा गुप्ता जी के लिए. तो मुझे ये बहुत बड़ा सौभाग्य प्राप्त होता है और मुझे ऐसा लगता है कि इस सौभाग्य में जो कुमकुम है वो तब लगेगी कि उनके शब्दों की शक्ति से जो प्रेरणा का संचार मुझ में हुआ है उसकी छींटें आप सभी लोगों के ऊपर भी बरसें. So ladies and gentlemen, please welcome the lady who is redefining Delhi with her daily works. Please welcome Srimati Rekha Gupta. Welcome, ma'am.
सद्भावना, क्या, व्हाट्स योर नेम मैम? शिल्पा भावना. मुझे सद्भावना हो गया, जैसे मेरे नाम में गड़बड़ किया ऐसे इनका नाम. अच्छा ही नाम है. यहाँ स्टेज पे उपस्थित पद्मश्री प्रोफेसर इंदिरा चक्रवर्ती जी, नमस्कार मैम। जैक सिम, who is World Toilet Organization's organizer, Mr. Dilip Kumar, our celeb International Social Service Organization's head. एक बार जोरदार तालियां दिलीप भाई के लिए हो जाए। मिस्टर डेविड महलोबो, जिन्होंने अभी बहुत ही अच्छे शब्दों में हम सबको सैनिटेशन को डिग्निटी के साथ जोड़ते हुए बहुत सुंदर बातें कही, और नित्या पाठक जी, जो कि पूरा कंधे से कंधा मिला करके दिलीप जी के साथ काम कर रही हैं। दोस्तों, बहुत कम फैमिलीज होती हैं जो पूरी तरीके से डेडिकेटेड हों टुवर्ड्स सोसाइटी, टुवर्ड्स नेशन, और एक ऐसे सब्जेक्ट पे काम करें जो किसी की सोच में ही ना हो। देखिए कितना अजीब सी स्थिति थी हमारे देश की, जहां शौचालय के उपयोग के लिए जनता को सोचने के लिए मजबूर किया जाना पड़ा। शौचालय का उपयोग, जहां ओपन डेफिकेशन इतना ऑर्डिनरी था, इतना नॉर्मल था कि ऐसा लगता ही नहीं था कि कुछ गलत हो रहा है पूरे देश में। सोचिए कि कब ऐसी मोमेंट शुरू हुई जहां लोगों ने सच में रियलाइज करना शुरू किया कि भाई खुले में शौच जाना गलत है, अपराध है, अपने लिए, अपने सेल्फ डिग्निटी के लिए, अपने स्वाभिमान के लिए गलत है। ऐसा कब से सोचना शुरू किया? यदि कोई एक डेट याद करते होंगे तो हम वो याद करते हैं जब 2014 में आदरणीय प्रधानमंत्री नरेंद्र मोदी जी ने लाल किले से अपना भाषण दिया और उन्होंने शौचालय की बात कही। Am I right? और लाल किले से जब कोई प्रधानमंत्री देश में शौचालय की बात कह रहा था तो करोड़ों लोग जो टीवी के आगे बैठे थे, अरे बताओ, प्रधानमंत्री जी अपने संविधानता दिवस के, इंडिपेंडेंस डे की स्पीच में शौचालय की बात कर रहे हैं। वेरी स्ट्रेंज। बहुत सारे लोग जो कि ड्राइंग रूम पॉलिटिक्स करते हैं, इंटेलेक्चुअल पॉलिटिक्स करते हैं, उनके ध्यान में भी नहीं था। इज दिस द प्रॉब्लम फॉर इंडिया? ये हमारी समस्या थी कभी? उनको पता ही नहीं था। सालों तक देश में इसी पैटर्न पे काम होता रहा। Nobody thinks about it. कोई सोच नहीं रहा था कि शौचालय कोई प्रॉब्लम है, टॉयलेट इज अ प्रॉब्लम। नो, लगता ही नहीं था। पर सच में जब मोदी जी हैव मेड 12 करोड़ न्यू टॉयलेट ब्लॉक फॉर इंडिया in our villages, in our colonies, मतलब what happened? Why this happened? 12 करोड़ शौचालयों की जरूरत थी, तभी तो बनाए गए भाई। और आज भी जरूरत है, आज भी जरूरत है, आज भी कोई ना कोई कोना ऐसा छूटा हुआ होगा जहां आज भी ओपन डेफिकेशन हो रही है। आज भी हमारे कल्चर से खुले में टॉयलेट जाना निकला नहीं है, खासकर मेल के लिए। उनको लगता है ये पूरा जहां हमारे लिए टॉयलेट है। बड़ी अजीब सी बात है। किस दिन हमारी ये सोच खत्म होगी? ये दिलीप भाई कब तक जा जाके अलग अलग जगहों पे टॉयलेट बनाते रहेंगे? कहीं तो हमें शुरुआत करनी पड़ेगी इस सोच को बदलने की। कहीं तो इस कल्चर में, कहीं तो अपने विजन में, कहीं तो हमारी सोसाइटी में और देश में हम सबको परिवर्तन लाना होगा। देश में एक समय पे भारत को कहा जाता है इट्स अंडर डेवलप्ड कंट्री। नाउ वी आर ए डेवलपिंग कंट्री। थर्ड इकोनॉमी है हम देश की। मैं मोदी जी की इस बात से पूरी तरह सहमत हूं कि इतना बड़ा देश है, 140 करोड़ लोगों का पॉपुलेशन, सरकारें कितना करेंगी, कर करके थक जाएंगी। जब तक सुलभ इंटरनेशनल जैसी संस्थाएं आगे नहीं आएंगी, देश की इस समस्या का समाधान नहीं होगा। 140 करोड़ लोग जब इस बात को तय करेंगे कि यस, टुगेदर वी हैव टू कम ऑन ए स्टेज एंड टू रिजॉल्व ऑल द प्रॉब्लम ऑफ आवर कंट्री, तब तक नहीं होगा। हर एक व्यक्ति को समस्या के समाधान के लिए काम करना पड़ेगा, वेदर दिस इज सैनिटेशन और टॉयलेट प्रॉब्लम और एनीथिंग एल्स, इवन पॉल्यूशन, हर चीज के लिए जब तक हम सब लोग इसे अपनी जिम्मेवारी समझ के काम नहीं करेंगे, तब तक इतना बड़ा, कहाँ पूरी आधी दुनिया और कहाँ भारत का पॉपुलेशन कैसे सॉल्व होगा भाई? क्या खाली गवर्नमेंट कर पाएगी? नहीं कर सकती, जितना मर्जी कर ले। इसलिए मैं बधाई देती हूँ सुलभ इंटरनेशनल को। आपने इतना सुंदर ऑर्गेनाइजेशन बनाया, वर्ल्ड टॉयलेट ऑर्गेनाइजेशन, जिसकी 25वीं सालगिरह के अवसर पे ये आपने सेमिनार रखा, जिसमें बहुत सारे कंट्रीज से हमारे डेलीगेट आए हैं। सब ने मिल कर के इस बहुत ही सेंसिटिव इशू सैनिटेशन एंड टॉयलेट, इस पे काम करने का ठाना, बिकॉज वर्ड इज़ अ फैमिली फॉर अस। हम सब एक परिवार हैं और इस परिवार को मिल कर के आगे बढ़ने से ही देश में और विश्व में इस समस्या का समाधान होगा। और वो दिन जल्द आएगा जब पूरे विश्व में हम सब मिल कर के इस प्रॉब्लम सैनिटेशन, टॉयलेट और इवन मैं तो ये कहना चाहूँगी कि जो एनवायरनमेंट पे काम होना चाहिए, ये हम सब के लिए बहुत बड़ा विषय है। मैं अक्सर लोगों को देखती हूँ, बातें करते हैं, काम नहीं करना चाहते, बहुत बड़ी बड़ी बातें। वी हैव राइट ऑन क्लियर एयर, वी हैव राइट टू ब्रीथ, बिल्कुल है। पर मैं आपसे पूछना चाहती हूँ, दिल्ली की बात करती हूँ, जहाँ 2.5 करोड़ की पॉपुलेशन 1450 किलोमीटर के अंदर रहती हो, जहाँ आज भी सीवर लाइन नहीं बिछाई गई हो, आज भी वाटर पाइपलाइंस 50% ऑफ द रिक्वायरमेंट हो, और आज भी जहाँ ट्रैफिक कंजेशन इतना है कि हमें घंटों सड़कों पे लग जाते हैं, कैसे पॉल्यूशन को हम कर्व कर पाएंगे? क्या हम सब ने सोचा कि जब पॉल्यूशन का ये मौसम आए तो हम कार पूल करके जाएं? क्या हमने सोचा कि हम पब्लिक ट्रांसपोर्ट को यूज़ करें? क्या हमने सोचा कि वी कैन वर्क फ्रॉम होम? क्या सोचा हमने? सरकार को कोसना। ओके, रेडी, जरूर आप कह सकते हैं, यू हैव राइट, पर पॉजिटिव सॉल्यूशन क्या है? गवर्नमेंट वो सब काम करेगी जो वो उसको करना चाहिए, और हमें तो अभी बहुत छोटा टाइम हुआ है, बट फिर भी सीरियसली हर फ्रंट पे हम प्लान करते हैं। अभी हमने अपना सभी RWS को हीटर डिस्ट्रीब्यूशन का एक प्लान बनाया, बिकॉज हर RW के गेट पे एक चौकीदार होता है। वो चौकीदार रात को जब ठंडी होती है तो वो लकड़ी जलाता है, लकड़ी जलाता है तो धुआं उठता है, धुआं उठता है तो प्रदूषण होता है। क्या आप लोग अपनी सोसाइटी में से जब बाहर जाते हैं, आपने नहीं सोचा कि ये लकड़ी जला रहा है, इससे धुआं हो रहा है, पॉल्यूशन हो रहा है? हु थिंक्स अबाउट दिस? किसने सोचा? मैं आपसे पूछना चाहती हूँ, क्या आपने उसको एक हीटर गिफ्ट करने की सोची? क्या अगर आप किसी RW के मेंबर हैं तो आपने सोचा कि भाई ये तो हम नहीं होने देंगे कि हमारी सोसाइटी में हम लकड़ी, कोयला ये नहीं जलने देंगे, हम अपना प्रेस वाला को एक वी विल गिव हिम इलेक्ट्रिक आयरन? हम नहीं सोचते, हमें लगता है ये सब चलेगा, नॉर्मल है, बाकी जो कुछ करना है सरकार करे। सरकार करेगी पर अकेले नहीं कर पाएगी, दैट इज फॉर श्योर। मिल करके करेंगे तो जल्दी होगा, अच्छा होगा, दुरुस्त होगा। इसीलिए आप सभी को मेरी ओर से बहुत बहुत बधाई और ढेर सारी शुभकामनाएं। सुलभ इंटरनेशनल को, they are working hard for the society. I really appreciate them, I really admire them, and I really want more and more organization should come ahead like them. Thank you so much.
Thank you so much, ma'am. Thanks a lot. And we are really thankful to you that you have given us a way forward, and that is what this valedictory was really about, that shared commitment to sanitation and dignity and climate resilience. So now, my dear friends, I would like to invite for the vote of thanks and closing remarks, Mrs. Abha Kumar. She is the Senior Vice President at Sulabh International Social Service Organization. Please put your hands together for her.
Thank you, Silpa. Honorable Chief Minister of Delhi, Srimati Rekha Gupta ji, Honorable Deputy Minister of Water and Sanitation, Republic of South Africa, Mr. M. David Mahalobo, Honorable Mr. Jack Sim, Honorable Dr. Indra Chakravarti, Honorable Sri Kumar Dilip, Honorable Srimati Nitya Pathak ji. A very good evening to all of you. Eminent speakers, partners, delegates, and colleagues and friends, I welcome you, and I would like to say good evening to all of you. It is my privilege and honor to offer the vote of thanks at the conclusion of this enriching valedictory session. Last 3 days have been a remarkable period of learning, collaboration, and inspiration. Each one of you has contributed to making this gathering meaningful and very fruitful. I express our heartfelt gratitude to our Honorable Chief Guest, Srimati Rekha Gupta ji, for her gracious presence and for encouraging us with her vision for a cleaner and healthier Delhi. Thank you, ma'am, for believing in us and for giving us your blessings. This will certainly help Sulabh International to continue the endeavor in future. मैम, आपने जो सोच की सभ्यता को बदलने के लिए कहा है, तो मैं बस ये कहना चाहूँगी कि 3 दिनों से जो यहाँ पे विचार विमर्श चल रहा था, उसका मेन सार यही था कि हमें सोच बदलना पड़ेगा और जो सोच बदलने की सभ्यता है उसको प्रैक्टिस में लाना पड़ेगा। बहुत बहुत धन्यवाद मैडम। Special thank you to Mr. M. David Mahalobo, Honorable Deputy Minister, for joining us and sharing valuable insights from global experiences. Sir, your presence has truly added an international dimension to our discussions. I would like to express my gratitude to Honorable Sri Mr. Jack Sim for always helping us, supporting us, and for making this summit a real successful event. I express my gratitude to Dr. Indra Chakravarti, always being there, and she is very helpful, very knowledgeable, and she also moderated one of our sessions very tactfully. Thank you, ma'am. I would like to extend our appreciation to all our esteemed panelists and experts from India and across the world who shared practical knowledge on financing, partnership, innovation, and community participation for sanitation. Your ideas will certainly help us to shape future strategies. A warm thank you to all our partners, supporters, and the entire organizing Sulabh team and the entire team of World Toilet Organization whose hard work and continuous effort have made this event smooth and successful. And finally, to all participants, thank you all for your energy, your questions, your commitment to improving sanitation and hygiene for the universe. As we close today's session, let us carry forward the spirit of collaborations and action. Together, we can turn idea into real change on the ground. Thank you once again.
Thank you so much, Abha ji. और वाकई में हम ये बात कह सकते हैं, मैं ज़रूर इस बात को एक बार फिर से दोहराना चाहूँगी that since this World Toilet Summit 2025 is hosted by Sulabh International Social Service Organization in association with World Toilet Organization, so WTO का जो है, this is the 25th anniversary and Sulabh was also working from so long, तो मैं बस इतनी सी बात कह सकती हूँ कि स्वच्छता के प्रति अभी ना पूछो कि हमारी मंजिल कहाँ है, अभी तो बस चलने का इरादा ही किया है, ना हारे हैं ना हारेंगे कभी, ये किसी और से नहीं, हमने खुद से वादा किया है। और हमारे इस वादे में आज हमें आशीर्वाद श्रीमती रेखा गुप्ता जी का भी मिल गया है, तो हम आपके बहुत बहुत आभारी हैं मैम। थैंक यू सो मच फॉर बीइंग हियर। आई रिक्वेस्ट ऑल ऑफ यू टू काइंडली राइज अप फॉर नेशनल एंथम।
जनगण मन अधिनायक जय हे भारत भाग्य विधाता, पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा, विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा, तव शुभ नामे जागे, तव शुभ आशीष मांगे, गाहे तव जय गाथा, जन गण मंगलदायक जय हे भारत भाग्य विधाता, जय हे जय हे जय हे जय 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 हे।
थैंक यू सो मच। इसके साथ ही हम आप सभी का धन्यवाद करते हैं। I request all of you kindly remain at your respective seats till the departure of our chief guest. So let us hear it for the dignitaries. We are having this group photograph on the stage, capturing this wonderful moment. Our heartfelt gratitude to all of you. Thanks a lot. With this, at World Toilet Summit 2025, I would like to say that yes, it has come to an end, but we all need to remember that end is not the end. It means effort never dies, and our efforts at World Toilet Summit will never die. So my dear friends, thank you so much for once again joining us. This is Shilpa Bhavna signing off. Jai Hind.